We the group 2 got second place in jigsaw puzzle. Ma'am, Physiology, HOD, ma'am, welcome. Dr. Ramya ma'am, Professor of Medicine from CMC Vellore as NMC Observer. I got triple R in my brain. And our beloved Dean Sir, Dr. Alfred Sir, emphasizing about BCME, and then we had a tea time break. The third session started with Dr. Sachidananda Sir, familiarizing faculty about goals, roles, competencies, deriving learning objectives, and highlighted the concept of IMG, emphasizing on the differences between traditional versus CBME curriculum, and gave us the group activity of specific learning objectives. The fourth session, our dearest Dr. Ramya Ramakrishnan ma'am made us learn to facilitate the students by transforming the sage on the stage to the guide on the side by enumerating various teacher learning methods, briefing about small group teaching. Then came Dr. Jyoti ma'am, coordinated 2K23 batch students and showed us jigsaw puzzle in small group teaching and interacted with all of us and made us understand. Had a short lunch break with tasty food, and then the session continued again, brainstorming us with 30-70 rule of interactive lectures for large group teaching. Fishball technique was fascinating, and the quotes that appeared on the screen motivated us to stay awake even though it's post-lunch session. The fifth session started by Dr. Kishore sir with a picture as a part of induction to know elaboratively on the principles, types, tools, and attributes of assessments, differences between assessments and evaluations. After a short tea break, final session of the day again by Dr. Shamdipti ma'am with a prompt for us to read, which fascinated us to know more about the session and made us understand the steps in designing internal assessment modules, student feedbacks, and developing a plan for internal assessment, formative assessment, and summative assessment, with few activities like think, pair, share, silent finger raises, and asked us to design formative assessment for a subject in each group as activity. Day 1 ended with reflections and feedback. The program aligned with NMC standards and equipped faculty members with essential skills for improving medical education quality. BCME not only strengthens teaching practices but also reminds us that even educators learn best with a mixture of structure, interaction, and humor. In short, the first day of BCME was productive, engaging, and surprisingly fun, and we are all ready for day 2. Thank you.
Thank you for very much wonderful briefing of day 1, Dr. Sripriya, and the day 2 session starts. Probably all are ready with your breakfast and ready to listen. Today it will be a very, what you call, day 1 is just like an opening kind of thing. Now today we will be having very a strong kind of thing that you will go into. I'll call upon for the first session our professor in professor in general medicine, Dr. Sridhar sir, for taking the AdCom module. Sir, Dr. Sridhar sir, first session.
రేస్ పెట్టండి, మినిమైజ్ చేసి పెట్టండి. మీరు ఒక పని చేయండి, దీంట్లో అక్కడ వేయకుండా ఫస్ట్ ఒక ఎంటీది ఒకటి డూప్లికేట్ చేసుకోండి. ఎంటీది
ఓకే సార్.
ఎంటీది డూప్లికేట్ చేసుకోండి. ఎంటీ ఎక్స్ట్రా స్లైడ్, న్యూ స్లైడ్, న్యూ స్లైడ్ డూప్లికేట్ కాదు, న్యూ. దాని పైకి పెట్టుకోండి, అది కిందికి దించేయండి. అంతే, అది అది ఓపెన్లో పెట్టుకోండి. ఇప్పుడు నేను చెప్పినప్పుడు స్టార్ట్ చేద్దాం.
డౌన్ ఇస్ నెక్స్ట్ సార్.
డౌన్ వచ్చేసి నెక్స్ట్. ఓకే,
పాయింటర్ వచ్చి
ఓకే.
కిందది ఈ పైది నొక్కారు అనుకోండి, మళ్ళీ అదే నొక్కాలి సార్.
పైన నొక్కితే
ఆఫ్ అయిపోతుంది సార్.
ఓకే ఓకే ఓకే,
మళ్ళీ అదే నొక్కితే ఆన్ అవుతుంది.
సరేలే. ఇది
డౌన్ నెక్స్ట్
నెక్స్ట్ స్లైడ్, ఇది ప్రీవియస్ స్లైడ్.
అంటే పొరపాటున మూవ్
సరే సరే. మీరు యూ కెన్ రైట్ ఆన్ యువర్ ఓన్. దెర్ ఈస్ no right or wrong. There are no right or wrong. There is nothing right or wrong in these responses. You can write on your own. Whatever you think, whatever you feel, that you can write. కిషోర్, పెట్టుకో. అది కాదు కానీ ఎందుకు ఇవి వీళ్ళు రౌండ్ టేబుల్ లాగా రాకుండా ఇట్లా కూర్చున్నారు? ఇంకొంచెం క్రాస్ చేసి ఉండొచ్చు కదా. మొత్తం సెమీ సర్కిల్ అయితే బాగుంది. విత్ ఇన్ ది గ్రూప్ దే కెనాట్ డిస్కస్. కొంచెం అట్లా పెట్టుంటే బాగుంటుంది కదా. చేద్దామా? కుదరదు.
ఇదిగా కనపడాలి.
ఏం కనపడేది?
రెండు టేబుల్స్
అది కాదు, కనబడేది ఏమన్నా మాట్లాడడం ముఖ్యం. కానీ చిన్నపిల్లలు ఐ థింక్ ఇట్ షుడ్ బి స్లైట్లీ లేదా రౌండ్ది అక్కడ క్యాంటీన్లో ఉంది. చైర్ ఇదేమో చైర్ మీద తిప్పుకోవచ్చు, అవసరమైతే ఆడ తిప్పుకోవచ్చు. చేద్దాము వద్దా? చేస్తాము వద్దంటే వద్దు మేడం. అడుగు అడుగు అడుగు. Namaste. Good morning to all the participants in basic course in medical education. I am Dr. Sridhar, Professor of Medicine. I have been entrusted with the task of discussing ADCOM, attitude, ethics and communication. Start with paying reverence to my teachers, Gurubhyo Namaha. First, before I commence what I want to tell, I will just narrate some words. Keep it in your mind. Listening, humility, ethical vigilance, attitude, ethics, responsibility, teamwork, patient advocacy, communication, professionalism, patient-centered care, empathy, compassion, cultural competence. That Shravan Deepti, you can distribute those things. They have already given. So, each one of you have been given a case scenario. Each group has been given. You can discuss among yourselves. Initially, you expressed your ideas about ADCOM in the questionnaire that was distributed to you. Now go through this case scenario, discuss among yourselves in the group, and the attributes which I have spoken to you just now, see whether any of them fits into your case scenario and write on the flipboard. Each group, the discussion will be done in the end. You can write down on the flipboard corresponding to your group 5 minutes discussion, and maybe as you continue to discuss for another 2 minutes, somebody will be writing the group's responses. Now your time starts. So, the specific learning objectives for this session, or by the end of this session, the participants will be able to describe the concept and need for ADCOM in competency-based medical education, apply at least 2 innovative methods to teach ADCOM competencies, and list and demonstrate 2 feasible assessment tools for ADCOM. So these are the objectives for this session. Now you will have to read it aloud. Scenario, everybody has to know. Read it aloud for you so that then only you can discuss, only one person who... Scenario was given, then share quickly. First somebody can read, 5 people can listen, read and share. Read and share. Read and share. Read and share. There should be noise. There should be noise at this time. Facilitators, you can go around and help them. Facilitators can go around and help them to discuss and write. Please don't discuss the content. Don't discuss the content. You can tell them what they can do. Tell them what they can do. No discussion of the content by the facilitators. Somebody can start writing. Somebody, you can enter somebody to write your views. One more time I am reading the attributes. Listening, humility, ethical vigilance, attitude, ethics, responsibility, teamwork, patient advocacy, communication, professionalism, patient-centered care, empathy, compassion, cultural competence. Start writing. Okay. Good. Very good. Enter somebody to write. You have about 2 minutes time. No, flip charts only. On the flip chart you have to write. Enter somebody, you keep dictating, they will write. But don't take into your hand. Write whatever you want to write. It is your job. Write whatever you want to write. exercise 5. Okay, oh, they gave exactly, okay. You can complete in 2 minutes. If you get ideas, you can go back and write in between, because discussion will be in the end. You can use newer terms also, your own terms also you can write. You can introduce your terms also, any new terms also you can introduce. Hello, I have given only sample of terms, but you can write and new terms also. Whatever you think better describes, you can write. Not limited to the terms I have mentioned. Kishore? ఒక చిన్న హెల్ప్ చేస్తావా?
చెప్పండి.
పోస్ట్ టెస్ట్ ఇట్లా వద్దు కానీ సింపుల్గా ఒక పేపర్లో చేత రాసినా పర్వాలే, టైం ఉంది కాబట్టి యాటిట్యూడ్, ఎథిక్స్, కమ్యూనికేషన్, అదర్స్, ప్రొఫెషనలిజం, అదర్ కామెంట్స్ రాసి ఈ కేసు డిస్కషన్ అయిన తర్వాత
ఎథిక్స్,
కమ్యూనికేషన్ ఇంకేదైనా కూడా ప్రొఫెషనలిజం, ఎనీ అదర్ కామెంట్స్ వాళ్ళకి లాస్ట్ 5 minutesలో రాపిచ్చేస్తాం.
ఒక వైట్ పేపర్ ఇచ్చారు.
వైట్ పేపర్లో ఈ హెడ్డింగ్స్ ఉండాలి. అంటే 5 గ్రూపులే కదా,
ఒక గ్రూప్ ఒకటి రాస్తారు.
అట్లనే చేస్తాము. అందరికీ ఉంటే టైప్ చేసిస్తే ఓన్లీ 5 words కదా, 5 words. యాటిట్యూడ్, కేస్ రిలేటెడ్ డిస్కషన్ 5. వీళ్ళ దగ్గర తీసుకున్నారంటే మీరు అనలైజ్ చేస్తే చక్కగా ఒక మంచిది వస్తుంది. ఈ కేసు ఉంది, వర్క్షాప్లో ఏం డిస్కస్ చేసినారు, ప్రీ టెస్ట్ పేపర్ ఉంది.
యాక్చువల్లీ వైట్ పేపర్స్ కావాలి.
అంత వైట్ పేపర్స్లో టైప్ చేసి ఉండాలి. కేస్ సినారియో, డిస్కషన్ రిగార్డింగ్ కేస్ సినారియో, యాటిట్యూడ్, ఎథిక్స్, కమ్యూనికేషన్, ప్రొఫెషనలిజం, అదర్ కామెంట్స్ అందరికి ఇచ్చేయచ్చు ఒక్కొక్క. Please resume your seats. You can write later also. You can resume your seats. Let us go ahead.
వర్డ్ డాక్యుమెంట్లో తయారు చేస్తాం.
అవును,
గ్రూప్లో పోస్ట్ చేస్తాం.
అట్లా
వాళ్ళు దే కెన్
పేపర్లో రాసుకో.
they can type.
Sure. ఎలాగైనా see, I told you the mechanism how you use it's up to you. And finally you have to collect all those things. And you can write a paper on that. Please resume your seats. We have to get along with our business. May I request all the participants to resume their seats. Please resume your respective seats. You get some idea in between, you can go and write. Now, first in outcome is attitude. These days, I have been hearing words, maybe because of exposure to social media or movies and all. మీకు యాటిట్యూడ్ ఉందండి. వాట్ డస్ ఇట్ మీన్? యాటిట్యూడ్ చూపించద్దు. These are the words we are using. Okay, in common parlance, whatever you want to tell, you tell. But actually, what is this attitude? We'll have to go. So, attitude is a predisposition of an individual. Predisposition, like we say predisposition to a disease, certain conditions, like that it is a predisposition of the individual. For what? We talk about cognitive, affective, psychomotor. Similarly, the predisposition to think, to feel, and behave or act how in a predictable manner. ఆయన దగ్గరకు వద్దుపా, ఆయన దగ్గర మాట్లాడితే అరుస్తాడు. ఆయన దగ్గర పర్వాలేదండి, వెళ్ళి ఏమనరు, చక్కగా మాట్లాడతారు, మనం అడిగింది ఏదో చేసి పెడతారు. ఆయన దగ్గర పోతే లేనిపోయిన క్వశ్చన్స్ వేస్తారు. ఆయన దగ్గర పోతే సైలెంట్గా ఉంటారు, మనకే క్వశ్చన్స్ వేస్తారు, మనల్ని ఏదైనా చెప్పమంటారు. So these are all different ways. Each individual is unique. No two individuals are alike. So it is a learned one. It is learned. How do you learn? The child is very raw. The child observes what is happening around. What happens around, it gets internalized. And over a period, similarly, when you go to school or when you come to college, in a way you are a child. And you see your seniors, your faculty members, your peers from, you belong to different social strata, different backgrounds, different regions. So, you see, oh, that's better one. The one from city is good. We should use the way he talks. We should behave the way he dresses. We should have all those things. So, these are learnt and they are stable over a period of time. Unless you make an effort to change, they are very stable. So, we can easily predict a person. They are stable and enduring. So, these predispositions are learned one, and then they are stable and they are enduring, and they behave in a particular way towards people, objects, situations and concepts. Some will be, the moment you talk, you attribute motives and then react. Some people absorb it and slowly respond. Think and some people keep quiet. So all these things, this is all attitude. So now you see, as a doctor, you come across different types of patients, one, and you come across students whose background as well as knowledge, their attitude and their behavior are different. So you have to contend with all these things to get along with your professional work. So that is the attitude. Did I tell that these are learned from book? Did I tell that these are learned from book? It's all experiential. These are all experiential. What you have experienced in your life events, that is the important thing. Now, and these are shaped by values. What is this value? So, this value, see, value is an enduring belief. Like, anybody from psychiatry here? No, probably no. And only the facilitator group is there. So, I know, there is a facilitator group. Now, enduring belief. These enduring beliefs, if they are real, it's okay. If they are not real, they are all called delusional. If there is a boundary between a belief which everybody can share, a belief which others do not share, a belief which sometimes people share and they don't share. So, they are of the type simple beliefs, overvalued ideas and delusions. So, these beliefs which are acceptable, rational and they are enduring, that is there. And the normative force, the value you are holding, that I must be punctual, is a value. So that value is a personal value, but that personal value takes the force of a norm in the society. The society probably encourages punctuality. For you to understand, in social psychology, there is a beautiful example about the time a person has an appointment with another person. So, one person, when he says 2 o'clock in the afternoon, it means 2 o'clock in the afternoon. Not 1:55, not 2:05. It is 2 means 2. That is called hora anglisca. Hora anglisca. That is English punctuality. Then there is another one, hora mexicana. I have got an appointment at 10 to 2 o'clock. I start for my appointment at 1 o'clock. And then as I stroll, everyone I come across, I talk with them for 10 minutes, 5 minutes, and then arrive for the appointment at 3 o'clock. That is hora mexicana. But here, the person who does, he has that norm of that culture. Mexican culture and this English culture. So that's a very important. So even though it is a individual value, it has the force that can reflect the society itself. Then guiding influence on behavior. You want to go at 2, your time is 2, but somebody says, hey, 2 kanto lunch too. You want to wait there. Hey, have your tea and go at 2:30. Nothing, it doesn't matter. You can just barge in. There is no problem. So that is guiding. Who has influence? Somebody else has influence. Somebody. So your value slightly changes. And then internalize your standard. And later on, here the guiding principle, when I talked about punctuality was guided. Punctuality was guided, so you come at correct time, and later on you internalize it. Nobody need to influence you. Hey, 2 o'clock, now it's already 1:45, you go. So that was a guided, and you went at 2. And over a period of time it gets internalized, and you think, whenever I have to go, I must go as per the appointment time. And then it's a cultural and personal significance. Personal significance, a sense of achievement. See, so and so, oh, we can trust that when he says time, he will come. That's a cultural, as I already told you, English and Mexico, that's a cultural aspect. So this value is a deeply held belief. It is a belief that is deeply held, or it is a principle that guides the individual's or group's judgment. Individual or group's judgment, as well as choices and behaviors about what is considered important, desirable and worthy. So these are the things which shape our attitudes ultimately. Then in CB, competency-based medical education concept, where do they fit into? The internal mindset shapes the professional behavior. Like in first year students, they come with shoes, they come with apron, they come with ID card, but in first clinical year they come with slippers, without apron, without stethoscope, ornamental some textbook and a backpack. These are all the important attributes of a first clinical. So it is an internal mindset that, so is this a professional behavior? So that means unless these are taught, or unless, as I already told you, they cannot be taught, they have to be observed, which means in the environment they should see all such things, then only they will it is a mindset. Then ethical orientation, integrity. Why you didn't bring all those things? I'm just now coming from home, sir. Just now coming from home. How does it rationalize? Then you should have taken things to your home, and from there you should have brought. So that is integrity. So to give some excuse, the integrity is lost there. So that's the important thing. Ethical orientation, integrity. Ethical will come back again. It is a societal. Moral is personal. Ethics is an organizational or societal rules and unwritten rules and all. So ethical orientation, integrity. Respect for patients, colleagues and society. So these things we have to, the various things I have shown, these things have to be palpably seen or perceived or felt by the patient. So respect for patients, colleagues and society. Then responsibility, accountability and sensitivity. Sensitivity of the issue. We cannot take very lightly certain things, because the patient has entrusted his life to the doctor. And then responsibility and accountability, this another thing. Then willingness to learn and improve, the growth mindset. See, nobody knows anything. Practically when I am talking about AdCom today, I cannot claim that I learned everything about AdCom. There are many lacunae in my knowledge as well as probably in my attitude, in my behavior. There can be some many lacunae. So we do not know. So willingness to improve. The perfection is never reached. Perfection is an ideal towards which everybody tries to reach that perfection, ever eluding ideal. Then demonstration of empathy, humility and altruism. Altruism is beyond self. Beyond self. So altruism is a very important concept. That is, you are sacrificing your personal interest at that time if necessary to serve the interests of your client or a patient. That is altruism. And empathy is to think from the angle or from the circumstances or from the context of the patient, which is a bit difficult but can be practiced. And humility, there are two principles in medicine. The first principle of medicine is primum non nocere. Primarily, do not harm. Whether you do good or not, do not harm. That is the first principle. The second principle is humility. Don't think that nobody knows everything. Nobody knows everything. So it's all when you are humble, when you have the humility, you will certainly consult with others who are better or worse. For you to understand, I can take an instance from Upanishads, Narayana Mahopanishad, in which Narada is said to be a very scholarly person. He knows everything. And he asked somebody, who is the most knowledgeable person in this world? Then to his surprise, the response is Sanataka, not Narada. Sanataka is, then Narada gets shocked. Oh, there is somebody who knows better than I. So he goes to Sanataka Kumara. He goes to him and then says, sir, it seems you know more than I want to learn from you. Then Sanataka Kumara says, first tell me what you know. First tell me what you know. Then he tells anatomy, physiology, biochemistry, pharmacology, pathology, forensic medicine, that and this and this. Then he tells, these are all only names. These are all only names. Now I will teach you what you have to learn. So remember, whatever we have already learned could be names. Could be names. There is more to learn about what you already know. So that's a very important thing. Here I stop for a while because I want you to talk now. Because continuously if I am talking, this is not a workshop. So you share whatever you want to talk about the 3 slides that I have till now projected. Quick. Anybody, just 1 or 2 responses. Otherwise, I don't get interested in talking. In fact, I was very tensed up today. I took one anxiolytic tablet in the bus and slept because unlike the earlier time, I thought I am not going to tell anything. I am surprised I am talking this up to this level now. And if you want me to talk further, I need some booster from you now. Please, anybody, anything? Anybody from anything? You have got your own experiences, anything, any word, anything, 1 or 2. People of all ages are there. Please, anything. You want to, somebody is talking? Please, quick. Otherwise we are wasting time. I will quickly run through the slides afterwards. Please, if you talk. Sir, మీరు మాట్లాడండి సార్. మీరే పెద్దవారు సార్. ఓకే, స్వామి నుంచి పేసప్ప. తెలుగు తమిళ్ స్వామిని తలుచుకొని మాట్లాడు. 2 బ్లాక్లో ఉన్నారు, మాట్లాడండి. నువ్వు కూడా బ్లాక్ మాట్లాడు. అందరూ బ్లాక్. So you came in that color. Whatever it is. Quick. I'm happy. Tell your name because I do not know many people.
So my name is Savita, sir. Anatomy department.
Anatomy, very good.
Yes, sir.
I heard about you a lot. Okay.
Yes, thank you, sir.
Tell.
Sir, even if we teach head comes to the students, it should come from the inside of the student. That is my first thing.
It should
come from the student, first of all. He should be in a recipient state to receive everything whatever we tell, and also he should be willing to know, and he should be interested to know, and he should think that he should be a perfect doctor in future. Then only he will.
You are perfect. Okay.
Yes, sir.
Okay. Now, anybody else wants to talk? Okay, nice. You have put
And
it-
one more thing, sir, in the present scenario, they are immersed too much into the mobile phone, sir. They are not even talking to their
Very
friends.
good.
In that way, the communication is becoming a big
We can
question
give the
mark,
horse
sir.
to the pond,
Yes, sir.
but we cannot make the But this ethics deals with moral principles guiding what is good or bad. What is good or bad? What is good or bad? Nobody knows. What is good or bad? Nobody knows. Nobody knows. Right or wrong and how individuals ought to act. It provides a systematic framework for evaluating human conduct. Human conduct. Systematic framework for evaluating human conduct. So, everybody is conducting yourself in the society every day, every minute. How you will be judged? Is your behavior ethical? So that's what. So ethics are rules we follow. Rules. It could be organizational rules. It could be society's rules. Those are the rules. And morals are beliefs we hold. So ethics forms the shared institutional culture of professionalism. This professionalism and outcome, they are intertwined. They are not separate. They are partially overlapping. So what are these shared culture of the professionalism? Then morals form the individual's internal compass. From your childhood rearing, from your parents and from your formative education, you imbibe certain things that forms the central core of your moral compass. So, a competent physician harmonizes both. So, there should not be a conflict between what you hold as good and what the institution or society says good. You try to harmonize. I said what is good, what is bad. We do not know. Two anecdotes I would like to narrate. One from Mark Twain's short story, Heaven and Hell. Heaven or Hell, Heaven or Hell. In which there is a character, doctor's character. Those days, during Mark Twain's days, anybody who is infected with typhoid is something like a death warrant. So, he comes to treat a person who is suffering from typhoid fever. And that person's aunts, two of them, spinsters, sisters, there's a Christian family. So in Christian morality, you should not utter falsehood. You have to be truthful. Now, everywhere it is there, but Christians more so. That's at least the stated one is they should not. Then the doctor comes. And so when he examines that lady and gets back, her daughter comes and he just pinches the cheek and says, she's in the pink of health. Oh, I see, pink of health, go and play. Something like that, so whatever it is. And once she goes in, then tells the aunts, this child is also having typhoid fever. Then she's taken aback, those sisters, they say, how dare you speak falsehood? Just now you said she is in pink of health and now you are telling she is having... Oh, what is there? I tell such falsehood so many times in a day. Shocked. Oh, That's unchristian. Oh, if my soul is to be condemned, let it be for a noble cause. If my soul is to be condemned, let it be for a noble cause. So, there he wanted the child to feel comfortable, so he was telling, so he may be condemned to hell, but then he is not worried. Now, I want this child to be happy, at least in the present moment. The second one, in graduation ceremony, what is the called Snatakotsava, in Upanishad they say, how a person has to behave when confronted with doubt. When confronted with doubt, what is right or wrong? You consider the experience of a man of good standing. How he would have judged or how he would have acted in those circumstances and follow that. So that is how you resolve. If assuming you have taken your father as the role model, or mother as role model, or one teacher as a role model, what he or she would have done under those circumstances, I would follow that when in doubt. So it is that is how you harmonize. Then now what do you do? This personal moral, this one in CBME, it is a disciplined application. It's not a random application. You have to have in your mind what I am going to apply here. These are the things that you teach and ask a short note questions in examination, which is a foolish thing in my view. So, autonomy, beneficence, not autonomy is, each person Mary mercy. That's what people say. This is my body, my wish. What I want to do is my wish. So there is autonomy. Beneficence, that is benefit to the patient, benefit to the client. Non-maleficence, no harm. Then justice, then honesty. Honesty, I will tell you honesty, very interesting. 1966, New England Journal of Medicine, a patient writes an article. A hemiplegic patient writes, he says, I don't want the doctor to tell me that I will be all right if I am not going to be so. I expect the doctor to tell me what are the methods available to help me and how new these are. That means they are not time tested. If they are time tested, it's okay. Yesterday only we found something, today I want to use it on some patient. 1 year, no experience. So how new they are. So that's honest he wants, honesty. And confidentiality. This is one thing we break frequently, the students also break. So you have to be very careful. Now that mobiles are there, take pictures everywhere. That's not correct. You have to take consent. And the students, if they are taking, we should really discourage them. And then professional relationships. We should not mix up our social relationships with professional relationship. Somebody might be a friend, even assuming, let us say, my child is my student in a college, then I cannot treat the child as a child in the institution. Has to be treated as a student. There is what is called a role set of roles. At home, child; at institution, student; at home, parent; at institution, teacher. So that's how we have to do that. And societal responsibility. Today we are all here comfortably sitting. You can say, I studied, I am earning, I have a job, I am entitled to sit here and learn. But at whose expense? At whose expense we studied? At whose expense all these facilities are created? So it's a society. So societal responsibilities, these are all the things that we have to teach. Then, okay, now any response about CBME? Any response? Anybody? This group is ahead. This group is ahead. The other 4 groups are still dormant. I expect somebody to talk about your experience in the wards or departments. No one want to tell anything? No one? No one? Usually ask individually. I don't leave anyone. Then I must know. No one? No one? No one? No one. Okay. Communication is a dynamic communication. It's a dynamic, bidirectional. That means I am not communicating with you. I am not communicating with you at all. I am not communicating with you. I am not communicating with you at all because you are not responding. Now it has become more of a monologue. More of a monologue, mono action. No response. No response. And how do you expect your students to talk? How do you expect your students to talk when you don't talk? Okay, it's a bidirectional exchange of information, thoughts and emotions. Remember, it's not just the way you use your words that conveys the emotions also. So, it's thoughts, emotions and meanings, hidden meanings. Meanings, they are not always explicit. There are implicit meanings also. So you have to, that's between the healthcare professional and the patient and the caregiver, and why you communicate. Purpose is at improving understanding the patient. Then decision making, what to do for this particular patient. 2 patients with diabetes mellitus or 2 patients with the same, let us say, keratitis are not same. 2 different. So, understand the patient. So, you don't treat a disease. You treat the patient with the disease as per Oslerian aphorism. So, you treat the patient. So, understand the patient, decision making and therapeutic relationship. Your communication itself has got a therapeutic value. Oh, doctor came and talked with me. So, that's a very important aspect for the patient. And now language, what language you use in communication, this is very nice. When I use a word, it means just what I choose it to mean. Is it so? I say, I'll use word. I see what I eat. I see what I eat. I eat what I see. Same words. Same words. Syntax. See, actually I meant to say, I see what I eat, and I said, I eat what I see. When I use a word, it means just what I choose it to mean. That means you think you have communicated, but patient doesn't understand. Then opposite, words mean what people want them to mean, even if wrongly used. Even though I say, I eat what I see, you will imagine, oh, sir will see some fruit and he will eat. Right? So, this beautiful sentence, what they call canonical in Alice in the Wonderland. And we are in the Alice in the Wonderland, where it says, everybody is mad. Everybody is mad. In a way, everybody is mad when we think all these things. Then, communication clinical practice involves eliciting information, providing information, ensuring understanding, establishing rapport, sharing decision making. This is what we said is a clinical skill. So, skills have to be fostered, practiced, so that they gain mastery over them. over a period, over a lifetime, Mastery is over lifetime. Key elements, verbal communication, non-verbal cues. There is a book on non-verbal communication, a full book available, which I did as a seminar in my MD General Medicine. MD General Medicine, I did a seminar on non-verbal, that is body language or non-verbal communication, going back in 1990s. Active listening, it's not hearing, it is active listening. Then empathy, professionalism, clarity and accuracy. Emotional intelligence, you need to have patience while dealing with patient. You should not get disturbed when patient again and again asks same thing. Sir, can I take this medicine? Do you want me to take this medicine? Do you want me to take this medicine today? Do you want me to take this medicine tomorrow also? So we need to have cultural sensitivity. The person who comes from different area, we have to understand how they communicate. Documentation, written communication, and team communication. That's very important. Then teaching and assessment strategies. These things will be taught later on. I can, because assessment is a separate this one, but this role, innovative and evidence-based approaches, role play, standardized patient interaction, reflective writing, portfolios. So all this you will come across later on in the assessment section. Then now, as I told you, AdCom is a culture. It is a culture where, everywhere, research integrity is a culture, humanism in medicine is a culture, quality improvement is a culture, and interpersonal respect is a culture. All this role very important. So, you have got an AdCom module, part 1, part 2, part 3, part 4 for each. So, AdCom is not a module but a culture. It must be integrated, experiential and assessed. Teach what we model, model what we teach. So these both are important. So it's not a rule book but a framework of mindful, ethical, personal, professional behavior. Now, our ancient concepts, quickly you can see. Bishakaha sarveshu guneshu bhuyat. That means the doctor is endowed with all good qualities. Roginam hitam acharet. That means for a patient, hitam acharet, that's what we said, beneficence. Hitam, patient ki edi manchido ade cheyandi. Upadesam satyam cha kriyate. Truthful, honesty, we talked about honesty, patient's example. Then sukham sariram rakshanam bishakatvam. So Sarira Madhyam Kalu Dharma Sadhanam is the motto of All India Institute of Medical Sciences, New Delhi. That means unless you exist, you cannot do anything. So exist means with bodily health, physical health. So Sukham Sariram. That means the body has to be healthy. So and that has to be protected. Rakshanam Bishakatvam. That is the quality of a physician. Vidyayeva Sakti Bishakatvam. Knowledge is an important thing. So it says, what mind doesn't know, the eyes do not see. What mind doesn't know, ears do not hear, listen. What mind doesn't know, the hands will not perceive. All these things are well-known aphorisms. Rogi Satyam Sutva Upadesham Dehi. When to counsel? Rogi Satyam Sutva. That means listen to the patient and understand the patient, and then only you start giving advice. Without understanding the patient, do not advise. Bishak Seva Param Hitam. Seva Param Hitam. That is service. Knowledge is important. Service is important. in Bhagavad Gita says, how do you learn? There are, one is by vidya, you know, pariprashnena, by discussing, pranipatena, that is invoking the blessings of the teacher. Then pariprashnena, by discussing, and then sevaya, by care, by taking care. The secret of care is caring itself. So by caring you learn. So then anupreksham vishakaryam na karoti. Don't ignore, don't do anything ignoring the patient. Everything has to be confided with the patient. Then, so purity of intent is suchi, professionalism, calmness, prasanna, pleasant countenance. Whatever may be your problems, you have to put up a pleasant countenance. One of my house surgeons who is now in US confided one day suddenly, sir, I have lots of problems, short of crying. Then immediately goes to the ward, tells, at that time she was working in pediatrics. Once I go to the ward, pediatric ward, I forget everything in the care of the children. So that's how, prasanna, dayalu, compassion, satyavakya, truthful, skillful conversation, sambhashana, and then anurakta bisha, devotion to welfare, these are all the qualities there. So, no rigid rules, no fixed scripts for behavior, authentic choice, reflective patient-centered decision, responsibility defines the person, responsibility defines the profession, freedom plus accountability leads to competence, that is equal to ethical accountability. And then axioms, being before doing, you be what you say. And then professional identity, you derive a professional identity, empathy as a clinical tool, ethical vigilance, medicine is a moral enterprise, empathy is teachable and it is essential. And then communication is therapeutic, professional responsibility transcends hierarchy. Don't say my superordinate, my boss told like this. Your boss may tell many things, but what is your response? That is also very important. That has to be respectful, that has to be polite. And then compassion improves patient outcomes, ethical reflection is continuous, failure is instructive, humanistic care augments technical care. So hidden curriculum, that is modeling after your teachers, what they don't tell but what you observe, that shapes the identity. Teamwork and shared decision making, moral courage is essential. Mother of Pondicherry, she says there are 3 types of courage. One of them is moral courage. Not physical courage is okay, then moral courage is also very important. Professionalism is observable and accessible. And it's question time. I think there may be 1 or 2 more. Let me see. No, that's it. So, anything you want to ask? Now, quickly discuss whatever you have written and we conclude the session. Whatever, group 1, now we will go from different, group 4, start with group 4. Group 4, whatever you told, quickly summarize. Mike Vendaniki.
Thank you, sir. So my EdCom exercise 4 is a young male patient is admitted in a comatose state. The CRMI notices he is mumbling numbers, contacts family across states and uncovers his history of injecting snake venom. With appropriate care, the patient recovers. So the question for discussion is, how did empathy and careful observation influence the patient outcome? So empathy allowed the CRMI to look beyond the patient unresponsive state and attempt to understand his distress. The second question is, discuss the ethical considerations of acting on incomplete formation. So the ethical consideration is the patient confidentiality, where you should be preserving the confidentiality of the patient. Then the respect for patient autonomy, like you just said right now about patient
No,
autonomy, sir.
what was exhibited in that?
The confidentiality of the patient, first thing, and even though the patient was unresponsive, he took an extra interest and he called the family members.
What
And
do you call it?
he found out the history of the
What do you
patient.
call that? I told you various things, patient advocacy.
Advocacy,
Good,
exactly.
you have written. Nice.
No, sir, I
It
didn't
doesn't
write that.
matter, doesn't matter.
I just put it.
Okay, fine, good.
So, third question is, how does initiative align with the professional responsibilities? So, the initiative was, he noticed some abnormal symptoms in the patient and he didn't neglect it. He investigated the symptoms. He took the extra care.
Not the symptoms. Patient was mumbling numbers.
Exactly, sir. So, that is the symptom. So, he investigated further.
You
He
thought it's a
contacted-
symptom, okay.
Yes, sir.
We can take it as a symptom, we can take it as a communication.
Yes, sir.
Okay.
So, here, what aspects of
Or
communication?
a cry for help,
Yeah, maybe.
okay.
Yes, sir. So the fourth question is, which aspects of communication were critical here? So first thing is active listening.
Excellent,
Second is the professional communication with the family.
good,
And the... Ma'am?
okay.
Demonstrating the consequences.
Exactly. A clear demonstration of the consequences.
Consequence means
Related to that illness, sir.
demonstrated.
I mean, we need to tell to the family members in...
Later, what happened alone? What happened? Okay, fine. Good, great. Give it. Group 2. This is group 2. Group 2. What's your case scenario?
My scenario is CRMI posted in medicine service
Oh.
on a Sunday when skeletal staff work made ward rounds and detected intestinal perforation in a patient with typhoid fever. He made referral to surgery service, prepared the patient for surgery and wheeled him directly to the theatre. He was successfully operated upon and moved to post-operative ward in surgery service for
Medicine to
recovery.
theatre. Okay.
So my first question, which attitudes and professional behaviors did the student demonstrate? So it was empathy, accountability, critical thinking, responsibility, and he was alert, he was courage, and it's a teamwork.
Oh, he's a courageous. So, moral courage.
Yes, sir.
He did not bother about what his chief will tell,
Yes.
what surgery
It was a
chief will tell. Simply he did what has to be done and the patient was operated upon. For your information, our?
Second question, how does initiative and responsibility reflect ADCOM competencies? It was a patient, he actually worked in a timely action and he was clinically skillful and he saved the patient on time and he was with commitment.
So he had
with a good
clinical
attitude.
skills.
Yes.
Served the patient. Okay, Sevaya, okay. Commitment, okay, responsibility and, okay.
So my third question, what ethical principles are involved in acting independently in critical situations? It was ethical vigilance and he was autonomous,
Okay.
justice to the patient on time.
Then last,
And how can the scenario inform the hidden curriculum about vigilance and moral courage? So ADCOM made our Indian medical gratitude to perform
Act
and to act
appropriately.
appropriately and effectively.
great, excellent. For your information, let me tell you that CME went on to become a pediatric surgeon and he retired. It's all our live cases, all live scenarios. Okay, group 1.
Our scenario is a 40-year-old lady was transferred from cardiology service to the medicine
Carefully
service.
listen, this is very important for those who make reference.
Medicine service as her vital parameters were within normal limits and ECG was normal. She complained of fever, recorded temperature was normal. Fever was the cause for transfer. She continued to complain chest discomfort and breathlessness. Physical examination did not reveal any abnormality and her Vidal test was positive and she was prescribed ciprofloxacin. In spite of reminder by the junior faculty, the consultant used to say cardiology opinion is neutral. So later she died suddenly due to acute left ventricular failure. Discuss in terms of outcome. So the first question is,
So, patient who was transferred from cardiology to medicine service for a putative fever died of acute left ventricular failure. without any premonition. And patient protested every day saying that she was experiencing chest pain. Probably people might have thought she is reacting, that is psychological overlay or whatever it is, and that's what has happened. Okay.
So the first question is, how does the scenario highlight humility for the physician? So here, even the reminder of the junior faculty, the consultant did not go for the further checkup or the further investigation of the patient's complaints. So here it is indicating that we need to consult the other persons in our healthcare team. We need to take even the junior faculty, our juniors' opinion also into consideration.
So junior's opinion also matters. For you to understand, I can narrate one incident in Kerala. In the morning, the whole team was around a comatose patient. They're all qualified. They would also thought, but because a super specialty mind suddenly gets blocked, so the junior most person who is only MBBS, he went late and then quietly started mumbling, why don't you give 25% extras? And when 25% extras was given, he sat up. So things happen. So
next question is, discuss bidirectional communication and patient agency. Here the bidirectional communication means from how the communication is between the patient and doctor. So here, even though the patient is complaining regarding the chest discomfort and breathlessness, the physician is not keen of listening to the patient complaints, and he is also not gone into the further investigations, and is not able to explain the what are the causes for the chest discomfort and breathlessness. So that led to the patient's death. Next is, how does empathy and professionalism manifest when the patient is well informed? So if the doctor has been think in the point of view of the patient, so it may lead to further investigations and further thinking of the physician regarding what are the reasons for these complaints in that patient. So this may lead to correct diagnosis or timely intervention of the patient. So it will lead to the positive development in the patient. Next is, what can we learn about narrative medicine and the patient-centered care? Here the narrative medicine and patient-centered care indicates that we have to listen to the story and the complaints of the patient from the patient point of view, and approach the patient regarding what are the complaints that has been given by the patient. And the patient-centered care means how the narrative of the patient is and what are the things that the patient is feeling, so that we have to go through that. So if we gone through the narrative medicine and patient-centered care, so we have the physician may have decreased that deterioration or death of the patient will be prevented.
You're from which department?
Community medicine, sir.
Good. Okay. Great. So here lack of listening. So the consultant, for lack of humility. Humility is a very important thing. So I may be wrong. I should be willing to listen to somebody. So 1 over, 2 over, 3. Group 3. One more group after this.
So the exercise says, a physician diagnoses a teacher with heart failure due to cardiomyopathy. The patient, aware of his condition, he responds calmly saying, thank you doctor, I am aware of my heart that is failing. So the questions for discussion are, how does this scenario highlight humility for the physician? So the patient is saying, thank you doctor, itself says he is aware of his condition, which highlights the humility for the physician. And the next question was, discuss bidirectional communication and patient agency. So the doctor and the patient, they're having a conversation about the condition of the patient, that is his failing heart failure, and the treatment aspects and prognosis of this patient. The next question was, how does empathy and professionalism they manifest when the patient is well informed? So understanding and acknowledging about his condition, the patient's condition and the prognosis, and respecting that he is aware of his condition, all this comes under empathy and showing empathy and professionalism of the doctor.
Good. Excellent.
Then what we can learn about narrative medicine and patient-centered care. So narrative medicine is describing about his condition, the prognosis aspects, and even to the extent of morbidity of the patient, and describing about his condition in a proper way and respecting the dignity of the patient.
Good.
Yes.
Good. You are from department?
Sir?
Yeah, department too?
Obstetrics and gynecology.
Oh, excellent. Good.
Yes.
You are, now they will come with obstetrics, somebody. A group. ఇది అయిపోయింది కదా now they will talk about obstetrics. Listen.
With severe falciparum malaria develops ARDS in MICU. Her parents are allowed at her bedside against usual rules. The father holds her hand and offers comfort. She dies within an hour, and the parents thank the doctor for compassionate care. Question is, how is compassion and empathy demonstrated in this scenario? So, doctor allowed parents to bedside for dying patient, which reflects compassion and empathy. How does the decision reflect? Ethical flexibility in critical care. So, doctor allowed the parents against the hospital rules, which shows ethical flexibility in case of critical care. How does this scenario illustrate the concept failure can also be success? So in this case, the parents thank the doctor for compassionate care. Even though her pregnant daughter has died, father has thanked the doctor by holding his hands. Discuss the role of cultural sensitivity in end of life care. So in end of life care, we has to obey the patients and parents, their cultural, if they want to do rituals, prayer, we can allow them.
Excellent, excellent, very good.
Usually we don't allow for, maybe for normal patients we don't allow, but for dying patient we have to give comfort, so they don't have any regrets that we cannot do prayers for the child or their loved ones.
Over. Thank you. Your friend? Now you see, he spoke about prayer. How many of you are aware that in Madras Medical Code there is a provision for calling a chaplain, calling a priest, calling an imam to the hospital to pray for the patient. So good practices get eclipsed. So it is for you, like young people like you, to ask for this. Just because we say we are secular, it doesn't mean that we are irreligious. Each one has got some belief. It's always pertinent to ask the patient whether they need any assistance with prayer. For example, in Christian Medical College, whenever BCME starts, it starts with the chaplain's prayer and explanation. So it starts with it. Whereas when we started this in this college with an Upanishadic saying, there is a protest by a Hindu person that this should not be done here. So that's wrong. What is wrong in thinking about good things in any religion? Any religion. We start with a good prayer. Start with a good prayer so that your mind is comfortable. So, in relation to patient also, where possible, somebody is praying, let us not disturb them. Let us not disturb them, citing the rules. That will be, no, you can always say, do it unobtrusively, without disturbing others. You have your own prayer, nothing wrong. Thank you very much for giving me this opportunity. I thank Dr. Ramakrishnan as well as the MU team for giving me this opportunity to share my thoughts on AdCom. Whatever little I knew, I tried to share with you.
The general
ATCOM module is being sent to your WhatsApp group, and along with it, a Word document is being sent regarding this ATCOM, where the scenario, the case scenario that has been given to each group. Please write a brief description about a few words that are being given, like what you call the attitude, ethics, communication, professionalism, and any others. Yeah. A slight change in the schedule. After this, you will be having, you can do it as a homework and then you can submit it later. Not right now. You can just type and then send it later. We will be having a tea break. After the tea break, we will be having the continuous session. I think Dr. Ramya, Physiology HOD, will be taking the session. Thank you.
I request everyone to assemble as soon as possible. Okay, good morning everyone. We'll start the next session. This is a 2-hour long session. So we've had a generous tea break, I would say. So my topic for today is effective clinical and practical skill teaching. So how do we teach skills? What are the different types of skills? And all that will be covered here. By the end of this session, we should all be able to at least know how to teach skills effectively, how to teach skills at the workplace. We should have learned how to use a skills lab effectively and to discuss the student-doctor learning concept. Now before moving on, I want to ask the audience, what do you mean by a skill? What is a skill? What is your definition of a skill? We'll start from here. What is your definition of a skill? Okay, that itself is a skill. Okay, any other definition? To perform an activity. Do it in a professional way. Okay. Anyone? Okay, a task which is learned specifically to perform properly in a professional way. From your, what do you think a skill is? Okay, sir. To demonstrate the correct technical method. Somebody from here? Okay. Effectively. Very good. Ability to perform a task effectively. Yes, from group 2? Same thing. Same thing means what? All three mixed or we've taken one?
Same, ma'am. It's the ability to perform a task effectively, perfectly.
Effectively and perfectly. Okay. Yes, sir.
A perfect way to do that job.
Okay. A perfect way to do the job.
To be good at something.
Be good at something. Very good. As simple as that. Any other thing? Okay, so we have had many versions of what a skill can be. So I would add one word to it, which say, learn by practice. Any skill cannot be learnt overnight, isn't it? So let us see the definition.
So a skill is an ability acquired through deliberate, systematic and sustained effort. Can you complete it? To perform some task, all of you told. Can you improvise on that? Okay, let me finish it. It says, to smoothly carry out complex activities. So, okay, there is no universal definition for anything, but this is largely agreed upon. Skill is an ability acquired through deliberate, systematic and sustained effort to smoothly carry out complex activities. Now, before moving further, again another question, maybe quickly you can tell. Are you scared of any skill? Are you scared to learn any skill, or are you scared to perform any skill? All of us have, isn't it? All of us are scared of doing some skill. Can you tell me quickly, one by one? Driving, 200 out of 100 I would say. What skill are you scared of? Driving, sir? Cooking? All skills. Okay, so you have overcome. I'll come back to you. How did you overcome? Next, sir. Driving, sir? Okay. Swimming? You're not scared of any skill? Great. Hiking? You're scared of hiking?
Because I felt pleasure.
Oh, so that caused that fear. Okay. Next, sir? You're also not scared of any skill. Okay. Sir? Swimming? Ma'am? Lying. Okay. So lying is a skill you mean? Okay. Okay. Any skill you're scared of? Sir? Driving? Car driving? Trekking, you're scared of trekking? Swimming? Bungee jumping, okay, yeah. Sorry? Public speaking, okay. Priya? You don't have to do that. It's okay, it's good to talk. Driving? Car driving? Swimming? Sir? Sitting at the back side when someone else is driving. Okay. Sir? Driving? Okay. Yes, I agree. Shopping with wife, sir said. While undergoing MRI, okay. See, that is like fear or phobia. We are talking about skill. A skill which you know how to do it, but you are scared of. Yeah, with practice you can overcome. Okay. So daily he has to get an MRI done to overcome that. Yeah. Driving. Okay. So all of you in this process, when I was asking what skill you are scared of, we have already covered most of the skills in day-to-day life. Some are swimming. What type of skill is it? Can you tell? What are the types of skills? I mean, yesterday whole day we have learned psychomotor, cognitive, affective. Okay. So what type of skill is this? Psychomotor. So most of you are scared of this. So how to overcome? Practice. What type of skill can this be? Cognitive. Again, psychomotor. These are all some good skills, isn't it? I thought you will tell this, but sir came up with this. So I'm happy it came. What type of skills can this be? How to overcome this? I have no answer. It's up to the men to decide how to overcome this. This can be, again it's cognitive skill. This one, what are they doing?
Negotiation, so it's a type of communication skill. Somebody said cooking. So, yeah. What is happening here? You see two adamant ladies and one person stuck in between. Handling mother and wife. It is a skill. It's a combination. I think a separate term has to be coined for that. Acting. Yeah. So this is many of you told about driving. So that's another skill. So this is very important skill of multitasking which all of us do. Do you know what this is? Yeah, it is calligraphy. The script is calligraphy, but can you? You read it from both sides. It's the same. So this is called as an ambigram. It's called an ambigram. You read it from both ends, it reads the same. Yeah. Even otherwise also. If you turn it the other side, it looks the same, it reads the same. Yeah. So these are all some skills I just wanted to open by telling that there are different types of skills. And so you have already told me about the types of skills. So we have intellectual or cognitive skills, procedural or psychomotor skills, communication skills, and team skills, including leadership skills. So very quickly I'll go through this slide. This is an approach to competency-based skill development. How we relate our competencies which are given in the curriculum and how we have to evolve to teach a skill with that. So the first steps are you review the competency, determine the level of competence, plan the learning sessions well ahead, and determine the method of skill assessment which we will be learning tomorrow. Today we will deal with how to teach a skill, tomorrow we will learn how to assess a skill. Okay. So this is an example of how do we learn a skill. What can you see here? Yes. A little deeper, we all know it is Karate Kid, Jackie Chan, and what's the other person's name here? Karate Kid, okay. Son of the other actor, no, Will Smith, correct, okay. So, okay, forget about the people. What do you see here? Practice, okay. Teaching, who is teaching whom? Forget about the people's names. Teacher and student, okay. So this, is it done these days? Can we do it? Can we do it in medical education? Can one person teach another person? Any other skill? Even teaching. Can you teach one-to-one? No, you cannot do it. So this is the olden days method. This is called as the master-apprentice model of skill teaching. This is another example of a master and a student. So master-apprentice model is a traditional educational method where a master or an expert teaches a student who doesn't know anything, a novice, teaches a student through a one-way communication process. So this is the traditional method of skill teaching. What are the advantages of this and what are the disadvantages of this? I want you all to discuss. I will not come to each table, you can just say, what are the advantages of this master-apprentice model of skill teaching? Yes, very good. So full focus can be on one student. Any other? Okay, so student is focused. Any other advantage? Easy to learn, easy to assess, okay. Okay, there are some of the advantages. Let's come to the disadvantages. Time, okay.
only one can be taught, okay? Difficult to escape, okay? Anything else? So Jackie Chan is a good master. If there was somebody else, lack of standardization, very good. I was looking for that. There is no set standard. How efficient the master is, we don't know. So the student will learn only up to that level. That is the biggest disadvantage. Another disadvantage is obviously time and people and all those things, standardization like sir said. So let us quickly just see some advantages. Advantages are, you have already told, direct hands-on skill learning, you have immediate feedback, real-time correction, experience-based knowledge is transferred. One-to-one training, there is higher level of motivation and engagement, and all these things reinforces professional values and work culture. Coming to the disadvantages, training quality varies with the master. That's what I told, it depends on the efficiency of the master and at what level they are, because the student will come only up to that level. Risk of passing on outdated practices. What if the master is not updated to newer techniques? Limited exposure to diverse methods. It is time intensive, and like one of you said, it is not scalable for groups. It's only individual person who can be taught. There is a dependence of the learner, and it is highly subjective. So what do we do? So we evolved from this master apprentice method to skill teaching in groups, where there is one teacher or facilitator and a group of 15-20 people can be taught different types of skills. I'll just play one video to show the importance of instructions in a skill training. How important is it is to give clear instructions to a person to get a task done. After that, we'll have a small fun activity. So I'll just show you this video.
Johnny ruined it on purpose. He knows how to make one.
What's up, the internet? You know what, I'm hungry. I could really go for a peanut butter and jelly sandwich. Do you guys think you can write down some instructions and teach me how to make a peanut butter and jelly sandwich?
Yeah.
Then do it.
I knew we were gonna do this. I heard Dad talking to Mom.
Choke yourself on my hand. Sometimes they do what you tell them. Step 1. Get 2 pieces of bread out. Get a butter knife and get some PB. Take 1 piece of bread, spread it around with the butter knife.
No, Dad, with the peanut butter.
I'm just doing what it says. It says take 1 piece of bread, spread it around with the butter knife.
Hold on.
Get some jelly, rub it on the other half of the bread.
No, Dad, open the jelly.
It doesn't say to do that. Put the breads together on top of each other. Take a big bite.
Sorry, I had to make it extremely specific.
Oh, good, I'm starving. Take 2 pieces of white bread out of the bag. Take the lid off the jar of peanut butter. Get a butter knife and stick it inside of the peanut butter jar. With the knife, scoop a bit bit of peanut butter out of the...
That means like a lot.
A bit means a lot?
In my world.
Spread your scoop of peanut butter onto one of your pieces of bread with a knife. Alright? There we go.
You're doing better than before though.
Open the jelly jar. Squeeze it onto the other piece of bread.
No.
Done. Closer. Get 2 pieces bread. Get some peanut butter. Take the peanut butter knife. Open the peanut butter. Put the knife in the PB. Get some jelly. Open the jelly. Squirt the jelly onto the bread. Take the butter knife with the peanut butter on it. Wipe it all over the piece of bread that's blank. Take the butter knife, rub the jelly all over the piece of bread.
Oh, it's doing better.
Says all over. Put the 2 pieces on top of each other.
This is how I live.
Take 2 pieces of white bread out of the bag. Take the lid off the jar of peanut butter. Get a butter knife and stick it inside of the peanut butter jar. With the knife, scoop some of the peanut butter out of the inside of the jar. Spread your scoop of peanut butter onto one of your pieces of bread with a knife.
No.
Squeeze some jelly onto the other piece of bread. Spread the jelly on the bread with the butter knife. Put your 2 pieces of bread, peanut butter and jelly sides together. Done. Get 2 pieces of bread. Get some peanut butter. Get some jelly. Open the peanut butter. Get a butter knife. Put the butter knife in the peanut butter. Take the butter knife out of the peanut butter.
You did it wrong. No.
Take 1 piece of bread and take the butter knife that has the peanut butter on it and spread it all over the top of the piece of bread. That's the top.
I mean the sides.
Squirt some on another piece of bread. Take the butter knife, rub it all over the top of the piece of bread.
I quit. None of it making any sense. Johnny ruined it on purpose. He knows how to make one. I know, Evan. It's the joke. It's the game that we're playing.
Do you know how to eat your piece of bread? You want to take your sandwich, Billy?
Okay, I think we can stop it here. You want to see the full one? It's the same. Okay, now that you have seen how to give proper instructions, we will have an activity. It's a paper craft activity. So we have 5 groups, isn't it? So the activity is to make, because it's winter, it's Christmas season, I thought we'll make a Christmas tree. So group 1 will have to look at the tree and make the tree. I request all of you to please keep your phones at the center of the table, just for this 5-10 minutes. Otherwise, there is no fun. My intention is to ask you not to use the phone. So the group 1 will look at the picture and make a Christmas tree. For group 2, we will give a set of instructions. So read those instructions and make the tree.
Group 3 will get another set of instructions and they will make the Christmas tree with the materials given. For Group 4, there will be a silent demonstration. So you see how it is done and you have to make. For Group 5, we do the demo, we break it down and we teach and we do, and you have to do it. You have to do it, sir. We will do it, then all of you have to do it. త్రీ షీట్స్ ఉన్నాయి కదా. ఆహా, ఒక గ్రూప్ ఒకటి ఇస్తే చాలు.
Each person take a white paper.
No, only 2 and 3.
Instructions our team కి ఇచ్చారు.
ఎవరికి ఇచ్చారు ఇన్స్ట్రక్షన్? ఆహా, నేను జస్ట్ చిన్న పాయింట్స్ రాశాను. ఓన్లీ one has to do. Each of you has to do. నేను పేపర్లో రాశాను చూడు. These are the instructions for you.
చేయాలంటే కొంచెం డిఫికల్టీ ఉంది. వేరే ఏదైనా చేయమని చెప్పండి.
మరి ఈజీ తీస్తే అందరికీ వచ్చు. Okay, I think we can continue. Time up. So we will start. Group 1, can you show us what you made? So group 1. Okay. Without instructions. Yeah. So this is what group 1 has made. And they were shown only the image and they were asked to do it. Okay, we'll come to that later. We'll come to the discussion again. How about group 2? They got a detailed instruction. Okay. Okay, something like this. This is what group 2 has made with detailed instructions. Okay. Group 3, they have made a monastery. Yeah. Okay, they got very brief instructions. And there is one more, just okay, close enough. With only 4 instructions, just 4 lines. That is better than detailed instructions. I'll come back to that. Okay, this group, there was a silent demonstration. So they have followed step by step. You want me to show all 4? So all 5 of them have done it. Big hand. Oh, this Gautam has done. Please.
Without details.
No. Step by step demo they have done. So you ask, for instance, you ask, speak to group 1. They are like, we have understood skill teaching. Please don't make us go through this. Okay. Okay, this is group 5. We asked them to make a tree. Ma'am showed and explained, they have done it individually. Okay. So now I want group 1 to tell what was the difficulty you faced. Was it okay? No, it was not okay. Why? There was no guidance. So you don't know, you were lost, there was no guidance, step by step approach, so nothing was there. They were just given something and asked to do, so that was the output. How about group 2, you got a detailed set of instructions. So too many instructions, that also is not good. Then? Vocabulary is complicated. Okay. So other than those 2? So it is not specific. So there are too many instructions, difficult vocabulary and not specific. Yeah, so visual aid will definitely help. How about group 3? Specific instructions were not there. Very few instructions were there. And? Oh, excellent. Okay, group 4, one very interesting saying. No instructions.
Silence speaks louder than words.
Want to say something? No. I think group 4 and group 5 have done equally. So one group, there was no instructions given, but it was only the visual cues which they have to see and follow, and they've done a good job. And for... We have trained them, sir. Shravan Deepthi. Big hand to Shravan Deepthi and Dr. Jyoti. So this is group 5, all of them have made beautiful trees. So I was seeing Dr. Jyoti teaching patiently and also yelling at them, why did you spoil this, why did you spoil that, I told you like this. So group 4 and group 5 have done very good job. Yes. So what do you understand by this? What do you understand by this activity? To teach any skills, clear instructions should be given. Then, which was the best output? I would say group 5
all of them have done, and equally nice. So what do we understand by this? First we have to break it into steps, step by step, give proper instructions, then observe what they are doing, do along with them, explain each step. After all this comes assessment. But essentially these are the important steps in teaching a skill. So now we know when we ask a student to just come and go and measure BP, will they be able to do it? They don't know. So first the knowledge aspect of it you have to teach them, then break it into steps, teach them once, do it along with them, and then make them do independently. That is the highest level of learning a skill. So this activity was to demonstrate that. So the same thing I'll just explain quickly. Let us take this example. This is the step 1 in which teacher writes on the board. This is, I would say, for group 3. Then in the step 2, the teacher breaks the task into simple steps. They teach the child how each arrow should come and how the alphabet A will be written. In the step 3, the teacher practices along with the students as they verbalize. Okay? And the last step, the teacher allows the students to practice. So this is the final level of achievement in when you are teaching a skill. So there is a 4-step approach to teach skills. It is called as Patton's 4-step approach. The first is demonstration, deconstruction, comprehension, and performance. These are the 4 stages in which any skill should be taught. So if we look at the previous example, so this is the step 1. So this is demonstration. What was the next one? They broke down this, how to write the alphabet A into individual steps. So that step, it comes under deconstruction. So there was demonstration, deconstruction, and the third one is comprehension, in which the trainer demonstrates while the learner describes the steps. And the last one is performance. The learner demonstrates while the learner describes the steps. So these are the 4 steps of teaching skill. They are called as the Patton's 4-step model. Now what are the stages in learning a skill? Somebody said swimming, somebody said driving. So before you have, say, there is a child, a 10-year-old child, you want them to go and learn swimming. Or even if anybody doesn't know how to swim, they say you go and learn how to swim. So what is the first thought that comes to your mind? Okay, you self-doubt. Is it possible? Will I be able to really do it? Next. I will swim. Okay, very good. That is a positive way to go about it. Anything else? Who will teach? Okay. When, where, how, the process, you think about the process. Okay. Now, there is a model to explain stages in learning a skill. So, level 1 is, what can you see? What is that expression on the baby? It's lost. Isn't it? Sorry? Confused. Yes. Okay. So, at this stage, the baby is unconscious of the skill. That means you don't know. Incompetent. Somebody wants to learn swimming, you don't know how to do it, you don't know the steps to do it. So this is the first stage of learning a skill in which you are unconscious of the skill and also you are incompetent. What do you think will be the next stage? Use the same. Conscious, incompetent. You know, you learn how it is to be done, but you don't know how to do it. So that will be the next stage. Conscious of skill, but incompetent. What will be the next stage? Conscious of skill and competent. Conscious of skill and competent. This is the first time, like supposing somebody goes to a driving school, you take your car independently and you start driving. First day after you got the license. You are very, very, very conscious of driving. It's almost like you sweat after you drive for 2 or 3 kilometers. So this is the third stage, that is you are conscious of the skill, but you are competent, you are good at it. What is the next stage? The skill comes naturally to you. It comes automatically. So that means you are unconscious. You're just doing it subconsciously and you are also competent. So that is the last stage of learning a skill. That is, you are unconscious of the skill and you are competent in doing it. So these are the 4 stages in which a skill is learnt. This is called as the conscious competence model of learning proposed by Bristow in the year 2007. So just to summarize, this is which stage? Unconscious incompetence is first, stage 1. Next is which stage? Second stage, stage 2, that is conscious incompetence. Next is conscious competence, and this is the last stage, unconscious competence. So when somebody wants to learn a skill, the aim is to attain this stage. Whether you are driving, you are cycling, you are doing surgeries, you are suturing, anything, whatever it may be, any skill, the final stage is to attain unconscious competence. Okay, moving on further, let us see what are some challenges in teaching clinical skills. Can you tell me some challenges faced when you want to teach clinical skills to the students? Okay, I agree with you totally. Students don't pay attention. Okay, anything else? Okay, so teacher. Okay, teachers should give clear instructions. Yes, sir? Okay. So the thing is, we know everything about it, but the student cannot appreciate it because he doesn't know. Okay. Large group size. Okay. Too many things going on. As faculty member, I am asking. We have too many things going. Yes, time constraint. Time constraint. Then. Okay, multiple levels, students at multiple levels. Very good, I was expecting that. Any other thing? It requires a lot of planning, isn't it? Planning, allocation of resources, logistics, time, and all those things. So one of the first thing is we have students at multiple levels. So teaching a skill becomes very difficult. There are other demands. Most of your clinicians, so patient care, to balance patient care with teaching itself is a challenge. Time constraints, most important is the last one. Lack of motivation. If somebody is motivated to, they will find time to do it, and they will find a way also to do it. So there are some tips to improve and expand our clinical teaching. Can I have some answers? What can be done to overcome those problems, to overcome those challenges? Okay, so divide them into small groups. Very good, sir. Yes? Explain step by step. Okay. No, we were talking about the challenges we face during skill teaching. So how to overcome those challenges? You told time constraints, lack of faculty, large group, logistics, time, everything. So how to overcome all this? Proper planning. As simple as that. All of us are good enough to teach. All of us are competent doctors. All we require is some motivation and some planning ahead. With that we can achieve. And we have to integrate all types of teaching. You can't sit and wait that on this particular day, on this particular time, I will teach this. So this skill teaching has to be incorporated into our daily teaching, and it's like a machine. All that has to be happening cyclically. So these are all some of the teaching strategies available for skill teaching. We will discuss a few, not all. So clinical case presentations, it's already going on, all of you must be doing it. Clinical problem solving exercise, it's very simple. You give a case-based question or a case-based scenario to the students, ask them to discuss in their groups and then present it and then have a discussion. Structured case presentation model, and there is something called as a SNAPS model and 1 minute preceptor model. I will briefly go through the 1 minute preceptor model and then we will have an activity. So these are the steps to overcome all the challenges which we just mentioned. Okay, coming to teaching skills at the workplace, here the very common, most of you spend time in the OPD, isn't it? So in the OPD itself, we can teach the students. So that is called as the 1 minute preceptor model. We'll have a quick demonstration before I go into the details. I request Dr. Siddharth and Dr. Pratap sir to please come to do a small role play. A table and chair. Siddharth is the teacher, Dr. Pratap is the student. So imagine they are in the OPD, surgery OPD.
Good morning, sir. We are 21 batch students posted in the Department of General Surgery for 2 weeks, sir.
From when are you coming?
From today itself, sir.
So there is one case called Sri Ramlu. Okay, he has a swelling. Examine the case. I'll give you 2 minutes time.
Okay, sir.
Then come back with your findings.
Okay, sir. Okay, right. Thank you. Yes, sir. Good morning, sir. Done with the case, sir.
Very good. You are very quick.
Yes, sir.
Tell me.
This is the case of sebaceous, sir.
Okay. So you are going for your diagnosis directly. Okay. So why do you think it is a sebaceous cyst?
It is soft and cystic swelling, sir, which you have seen over the thigh region. So I thought it as a sebaceous cyst.
Okay. Now you tell me, there are many other swellings, soft tissue swellings in the body, right? So now, how will you differentiate this swelling from the other swellings, and why are you telling it is a sebaceous cyst? Right. No problem. Now you have given a very good diagnosis. I accept the diagnosis that it is a sebaceous cyst. But now I want you to know why it is a sebaceous cyst. Okay? So if I tell you everything today, you will not go and read.
No.
So go back, open your Das textbook, and then read why you think it is a sebaceous cyst.
Okay, sir.
Then you will know how you will differentiate this swelling from the other swelling.
Okay, sir. Okay, sir.
Very good.
Okay. Okay. Thank you, sir. Okay. Okay.
Thank you, sir. So, any observations? What happened? What was the role play about? What exactly happened? Student presented a case to the teacher. So, what did you observe in that interaction? Okay. student came unprepared, okay. What was the reaction of the teacher for that? He was encouraging, okay. Go back and study, so that was assignment. Anything else? Anything else you observed? Okay.
The faculty didn't see how the case was taken by the student. He just listened to whatever the student told. He didn't see whether he went personally.
He didn't ask the differential diagnosis.
Always you should not spoon feed the student, you should give him opportunity to go and read about that or discover something.
No spoon feeding. Spoon feeding should not be done is what he's telling. Any other findings? Sir? Whether the student has seen the case or not.
Someone has told the diagnosis.
Okay. That's what it was Savita's point basically. So you don't know whether they have actually examined the patient or not. Okay. So these are some of the findings. Actually, I want to play another video, but I think you want it?
A 45-year-old woman who fell down 3 steps and she landed on her right outstretched hand. She had some pain and swelling over the lateral part of her elbow when I examined her, as well as some pain over her distal radius. Her elbow flexion is also decreased and she has pain with supination.
Okay, so what do you think's going on here?
I think she just has a simple sprain of her elbow and wrist.
Okay, did you think about anything more serious?
Well, I looked for fractures on the x-ray, and I didn't see any fractures of the elbow or the wrist. And when I palpated over her snuff box, she didn't have any pain or tenderness, so I think a scaphoid fracture is quite unlikely.
What we'll do is we'll go and take a look at the x-rays, and when we do, I want you to take a good look at the lateral view of the elbow, and look for a Sale sign. So you see that when the fat pad's elevated by intra-articular hemorrhage, and that sometimes can be the only sign of an occult radial head fracture. So, let's go take a look. You were right to think of a fractured scaphoid with that mechanism of injury, but I think with the lack of tenderness and the normal x-ray, I think that rules it out. But I do think she probably does have a fractured radial head. If you look at this Sale sign here, you can see the elevated fat pad. And even though we can't see a fracture on the radial head itself, we can infer it from seeing that. So, I think we should treat her for that.
Okay.
So we'll go back and see her.
Sure.
So how many of you, along with the video, how many of you paid attention to the steps? What is the first one? get a commitment. No, what was written at the bottom? Get a commitment. That means first thing they say, what do you think of it? After they present the whole case, they say, what do you think of it? What is the next step? Probe for evidence. Why do you think you said that? What is the third step? What? General rules. Okay, how it is normally done. Last, fourth one. You correct it and then ask them to improvise. Okay. So the first step will be, just a second, get a commitment. Second one, probe for evidence, and then teach a few key points. That is what you meant by reinforcing. Feedback. You tell them what they did right and correct the mistakes in a gentle manner. So the first two steps, that will give us an idea about how much the learner knows and whether they have done it correctly or not. Whether they have actually gone and examined the patient, like somebody, like Savita raised. We don't know whether they have actually gone and spoken to the patient. So if somebody has told and they've actually done it, by the time they finish the first two steps, we get an idea. So what is the purpose of getting a commitment? What is the importance of telling, what do you think of this? Assessing existing knowledge, okay? Any other thing? You know, if you give ownership to somebody and say, you tell me what you think of this first. If somebody tells that to you, what do you feel? You feel happy. You feel happy because that autonomy is given to you. You feel like you're also valued because your professor is asking you to tell what do you think this is. You know, instead of telling what I'm telling is correct and whatever you have in mind is of no use. So getting a commitment is important because that is the starting point. It focuses the learner to put things together. You are forced to commit. When they ask you what do you think of this, you have to tell something, isn't it? So you are forced to commit. These are some of the strategies which we can employ. The first, in the stage of getting a commitment, these are some positive points which as a teacher you can ask the students. You can say, what condition are we treating? What do you think is going on with this patient? What do you think is the main problem? Okay? What would you do if you were alone? What are some things which you cannot do or which you should not do? These are some positive points which you will tell the student when he is presenting a case in the first step. Can you tell me some things which you are not supposed to tell the student, which makes them, you know, criticize them? Example, give me a sentence. Let's keep it a little lively. You can't even tell this, okay? Oh, don't tell me about it. Yeah, that's very, very common, especially from general medicine department. Anything else?
You should try to be like that student.
Comparison, very good, point taken. Anything else? Yeah, how can it be? So that these are all some negative aspects. So some of the unhelpful or something, you know, one thing, all these criticizing comments, another thing, the professor thinks he is right. And without listening to you, without analyzing anything what you have told, he will clearly tell, maybe he is right, maybe the patient has got pneumonia. But then instead of explaining why that condition is pneumonia, they will clearly tell, he has pneumonia, go and admit him. This instantly demotivates the student. So student will be thinking in their mind, isn't it? Can you discuss on what I have told, why they have got pneumonia, why not something else? So these are some things which we have to avoid. Coming to the next step, that is probe for underlying understanding. These are some positive findings or positive points which can be used. What were the findings that led to this diagnosis? How this is different from something else which we have seen? What else can cause similar? So all this is basically you are giving them a differential diagnosis. You are asking them to give a differential diagnosis. These are some things which you should not be doing. Okay? Why you didn't attend last class? You didn't know what I taught you? Okay? Are you kidding me? Is this a big joke? What do you think of yourself? So these things should be avoided as much as possible. Then make a few key points. 1 to 5 take-home messages. And then we give feedback. Say highlight the positive aspects first, and then you correct the errors. So usually they say the ratio of positive to negative points should be 3:1. See, I understand it is totally subjective. If somebody has come and blabbered everything wrong, and all these things don't apply. But largely, if we take the average group of students, this is applicable. The feedback should be immediate. It should be given then and there. That is important. So you presented the case, okay, meet me tomorrow, I'll tell you. But the whole gist is lost. Feedback should not be a personal attack, and it should not be embarrassing, and it should be specific. Most important, if we put our ego aside, and if the student is worthy of it, you ask them how I was teaching or how you were teaching. So solicit feedback on your performance. Why this is important? To take feedback on how we taught to some second year or first year student. To improve ourselves as a teacher. Okay. No, not exactly self-directed learning. Like see, we gave the instructions. So what did they tell for that activity? They said there were too many instructions. The vocabulary was too tough. So next time what we can do? We can adopt that and correct ourselves. All students might not be of the same caliber. We've already discussed this topic. Some are very intelligent. Whether you do or you don't do, you teach or don't teach, they will learn by themselves. So some student will tell, okay ma'am, you told everything in English but I couldn't understand. So taking feedback on our performance helps our learning as well as what you intend to teach the audience. So these are some of the examples. I think it was clearly explained in the role play done by Dr. Siddharth and Dr. Pratap, and also in that quick video which we showed. So this is optional, you can give them assignment. So this is to summarize the 1-minute preceptor model. So the first step is, what is the first step? To get a commitment, then you probe for evidence, teach some general rules, reinforce what was done right, and then correct the mistakes. Okay, this was done. So where are we in teaching a skill? From the time I started my session, it's been 1 hour. What all did we learn till now? Can we just have a quick recap? All of you look lost. Patent's 4-step. Very good. Thank you so much, Dr. Gautam, for summarizing. So what are the patent's 4 steps? Demonstration, deconstruction, comprehension and performance. So followed by that, what did we learn? Stages of learning a skill. Followed by that, some challenges in adopting to teach a skill, how to overcome those challenges. Followed by that, teaching skills at the clinical skills, some methods to teach clinical skills. So in that the first one was 1-minute preceptor model, which we have learned thoroughly now. Next is a SNAPS model. This is also to teach clinical skills in the bedside. So what does SNAPS stand for? S to summarize, then you narrow down. Somebody rightly said, once the history is presented, you have to come to some differential diagnosis and then analyze what supports this differential diagnosis, and then you probe, look for evidence, plan of action to manage the patient, and then finally select. That is, you choose a question to pursue self-directed learning. That is what they say, go back and learn regarding this topic. So this is the SNAPS model to to teach clinical skills. Next, we will go on to how to teach communication skills. AdCom was done at length in the morning, so I will not go into the details of AdCom. We will come to communication skills. Again, a 10-minute discussion we'll have. I can see some are very sleepy. We just had tea break. So I will give you 5 scenarios to each of the 5 groups. I'll give you 5 minutes time. Each group has to do a role play. Each group has to do a role play. You decide who will be the doctor, who will be the patient. So group 1, the scenario given to you is to breaking bad news. For group 2, the scenario is obtaining informed consent for appendicectomy. For group 3, the scenario is counseling the mother to administer ORS to a child. Group 4, counseling for screening of mammogram. And group 5, counseling a student for failing in internal assessment. So shall we have 10 minutes and then 5 minutes each for presentation. So after communication skills, we only have how to teach skills in a skill lab. With that, I'll finish my session. Okay, your 10 minutes, I don't want to be very filmy, but they say your 10 minutes starts now. 5 minutes, okay, just 5 minutes. So very quickly, decide among yourselves and we'll have a role play. Again, very short role play, maybe 3 minutes each. Are we done? 2 minutes? Okay. I think we will start. We'll have very quick role plays from each group. Let us see who did the best. Group 1. Okay, is group 5 ready? Which group is ready? Sir, you can come. Please come, please come. Yes, please come. Introduce who is the teacher and who is the student.
Yeah. Hello, hello.
First name చెప్పాలి
Introduce. I am the
Oh, sorry.
It's okay though. Yeah, I am the teacher.
Okay, silence please.
Yeah, I am the teacher and sir is a student.
Doesn't fit, but
Okay. Yeah, scenario. Just వచ్చేసి come here. ఇక్కడికి వచ్చేయండి
డ్రాయింగ్ చేస్తున్నట్టు
చెప్పండి సార్.
Hi sir, morning.
Yeah.
I failed in anatomy.
Yeah, good morning. Yeah. Yeah, have a seat if you want. It's okay.
Have a seat.
Have a seat. Have a seat if you want to. How is it going? How are you?
Yes sir, it's going fine. I failed in my exam.
Yeah, how is it going? How are you?
Yes sir, I'm okay. It's going well, but I failed in one of my exams. I'm feeling sad for it.
Yeah, that's okay. We are with you. Don't worry about it. Yeah, how are your studies now? How are you planning your studies?
I feel it was a corrector's mistake. I should have not failed.
Yeah, maybe that's okay. We'll talk about the correction later. Yeah, let's talk about your studies. How are you planning your daily? How is your daily routine? How are you studying? Is it okay?
Yes sir, everything's going well.
If you have any issues, you have failed in internal assessment. Failed. This is not the final exam. Don't worry about it.
Thank you.
Yeah, that's okay. Yeah, just narrowly you missed it. We are here with you. Even if you want, we have remedial classes. We have remedial exams. Don't worry about that. We are here. We are like your parents. If you want anything, you can talk to us.
Thank you so much sir.
Yeah. Where we are. Yeah. Thank you.
Thank you, sir. So any comments from the other groups quickly? Failing in internal assessment. To counsel a student who failed in internal assessment. Any comments from the other groups? Very soft teacher. The students will love it. Love you. Okay. Okay. So there was no... So he was being positive. You say too positive? I'll use this.
So the teacher was very loving and soft, ma'am.
Teacher was very loving and soft, which is a good thing, no?
Good thing, but he should also be very strict when he is telling that you didn't read well, that is why you fail. It is not the mistake of the character.
Gen Z. Okay. Any other group? Any other comments? You have something to say? Always. Nothing to say? So it was good or it was bad? It was good only. Anything else?
How many marks he has failed, how many percentage he has got?
Percentage they didn't ask. Very good question, sir. They said narrowly failed. Narrowly failed. So we don't know how much that narrowly is. How many subjects? Okay. So the metrics. Okay. I think it was a quick role play. So taken. Any comments from the MU and CC members regarding that role play? They did. Yeah, thank you so much. So next group, what was the scenario?
Counseling the patient to get it.
Yeah, please come. Quickly.
Today my scenario is regarding counseling for screening mammography. Hi, I am Dr. Anil. Today I am going to discuss regarding the screening mammography. Not audible, sir. Good morning, I am Dr. Anil. I am here to talk regarding the screening mammography. What's your age? What's your good name?
Jyoti, sir.
Okay. What's your age?
46.
46. Do in the family members, do you have any lumps in the breast?
Yes, sir. My aunt has died with breast carcinoma.
Okay. At what age she was diagnosed with carcinoma?
58.
58.
At the age of 58.
Okay. At what age she died?
62. So within span of 4 years.
Okay.
And in spite of taking multiple chemotherapies and
Okay. She underwent any surgery or only chemos?
No, mastectomy.
What stage she diagnosed? Whether the early stage or advanced stage?
Sir, as per my knowledge, I had triple negative.
Oh, triple negative. No, I'm asking just stage, whether it's early stage or advanced stage?
Advanced stage.
Advanced stage. Only chemo she underwent?
No.
Chemo, radio, everything she underwent? Okay. Other than your aunt, is there any other family member, second degree relatives having the breast cancer?
No, sir.
No, nothing. Okay. Now you are experiencing any complaints regarding the lumps in the breast?
Nothing, sir.
Nothing.
My concern either to do that mammogram or not, is it good to do it or not, that's all.
Okay. No, you have to undergo mammography because your family history had a breast cancer. So she was diagnosed for 58 years, right?
Yes, sir.
So you have to do screening mammogram almost from the 45. Okay. Usually we'll go for 40, but you had a aunt had diagnosed of 58. So we start mammography at the 45 years. Then you go for yearly mammo. Okay. So up to 75 years you have to go for screening mammo. So in between, whenever you are going for a mammography, you have noticed.
How often you should do it?
No, yearly. You have to go yearly. Okay. So in between the mammography screening, if you identify any lumps in the breast or you identify any lesions in the mammography, so immediately you should go for the further testing. Okay. Like we'll go for needle testing like that. Then we'll confirm whether it's a malignancy or a benign thing, we'll confirm. Then depends upon the state, we'll proceed, the different treatments are there.
Okay. How much it will be cost, sir?
No, it's around, it's a bit less expensive only, okay. Cost effective only. So we can go for the screening every yearly. It's a mandatory.
Okay. Thank you, sir.
Thank you.
Thank you very much. I think it was very well done. It was very good. We almost felt like a real doctor and patient. They enacted very well. Okay. Any comments from the other groups? Anything they missed? Yes, sir? Okay. 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 So it was about counseling. Okay, sir. Well taken. Okay, now this group. Please come.
Namaste, sir.
Namaste.
So now we are dealing with the counseling of a mother for administering the ORS. So I am the mother and so I will be the doctor. Namaskaram, sir.
నమస్కారం.
మా పాపకు 2 రోజుల నుంచి మోషన్స్ అవుతున్నాయి, సార్.
ఓకే అండి. ఏజ్ ఎంత అండి బేబీ?
3 సంవత్సరాలు, సార్.
3 సంవత్సరాలు. ఎన్నిసార్లు అవుతున్నాయి రోజుకి?
రోజుకి 2-3 సార్లు అవుతున్నాయి, సార్.
2-3 సార్లు. యాక్టివ్గానే ఉంది బేబీ?
బాగానే ఉంది, సార్. కాకపోతే ఎక్కువ అవుతా ఉంది.
వాటరీ వస్తుందా?
అవును, సార్. నీళ్ళగానే ఉంటుంది, సార్.
ఓఆర్ఎస్ అడ్మినిస్ట్రేట్ చేద్దాము.
ఓకే, సార్.
అండ్
లూజ్ స్టూల్స్ అయినప్పుడల్లా విల్ అడ్మినిస్టర్ ప్రిఫరబుల్లీ WHO approved ORS will administer. You need to mix it in 1 liter of water, and whenever the baby passes loose stools, you need to administer it. Whether the baby is accepting orally well or not, active, right?
నాకు మీరు చెప్పేది అర్థం కావట్లేదు సార్.
బేబీ ఈజ్ యాక్టివ్గానే ఉందా లేదా అనేసి.
బేబీ యాక్టివ్గానే ఉంది సార్.
ఓరల్లీ ఫీడ్స్ యాక్సెప్ట్ చేస్తుంది అనేసి.
తాగుతుంది సార్.
తాగుతుంది. దెన్ ఓఆర్ఎస్ అప్లా 1 లీటర్ వాటర్లో ఉంటుంది కదా,
బయట ఓఆర్ఎస్ అని ఒకటి దొరికితే అది ఇచ్చేసాను సార్. ఇవ్వచ్చా సార్ అది?
అది వద్దండి, అదే WHO అప్రూవ్డ్ ఓఆర్ఎస్ ఉంటుంది. ఆ ఓఆర్ఎస్ తీసుకొని ఆ పౌడర్ని 1 లీటర్ కాచి చల్లార్చిన నీళ్ళల్లో కలిపి, సో దాంట్లో సార్ ఎప్పుడైతే బేబీ లూజ్ స్టూల్ వెళ్తుందో అప్పుడు ఆ బేబీ ఎంత యాక్సెప్ట్ చేస్తుందో అంత ఇస్తారండి. వాటర్ కంటే అండ్ అంతేనండి.
థ్యాంక్ యూ సార్.
Thank you very much, Group 3. I think it was well done. What was one thing which you all noticed? Local language, very good. So that the message was conveyed very clearly. The doctor was speaking in English, so the patient said, I can't understand a word. So that was one very important aspect. Any other comments? So we'll give them a big hand. Very well done. Thank you so much. Yeah, the next group. So the scenario given to them is obtaining informed consent for appendicectomy.
In this role play, I'll be playing and acting as a mother. She'll be my kid, 10 years old, and the doctor.
Hello, Ma. I just called you for describing your child's condition.
అమ్మా నాకు ఇంగ్లీష్ రాదమ్మా, తెలుగులో చెప్తారా?
సరే అమ్మా, ఓకే. ఇప్పుడు ఏంటంటే ఇప్పుడు మీ పాపకు వచ్చేసి కడుపు నొప్పి అని చెప్పి వచ్చారు కదా, పొద్దున వచ్చారు. సో తనంతా ఎగ్జామిన్ చేశాము, తర్వాత స్కాన్ కూడా చేశాము. దాన్ని బట్టి ఏంటంటే లోపల అపెండిక్స్ వచ్చేసి వాపు ఉందని ఇచ్చారు. అపెండిక్స్ అంటే ఏంటంటే మనకి పెద్ద పేగు చిన్న పేగు కలిసే దగ్గర అపెండిక్స్ ఉంటుంది. సరేనా?
అలా చెప్తే అంత అర్థం అవ్వదమ్మా. పెద్ద పేగు చిన్న పేగు పాపకి నయమయ్యేలాగా మాత్రం చూడండి.
అదే మా చెప్తున్నాను. ఇప్పుడు ఏంటంటే అపెండిక్స్ వచ్చేసి మన శరీరంలో ఒక భాగం, కాకపోతే తీసేసినా కూడా మనకి ఆ అమ్మాయికి ఫ్యూచర్లో ఏ ఇబ్బంది అంటూ రాదు. సరేనా? ఇప్పుడు ఏంటంటే అపెండిక్స్ వచ్చేసి మనకి పొట్టకి కుడివైపులో కింద భాగంలో ఒక కోత కోసి లోపలంతా మనం ఓపెన్ చేసేసి అపెండిక్స్ని రిమూవ్ చేసేస్తాము, తీసేస్తాము. అర్థమవుతుందా అమ్మా? ఇంజెక్షన్ ఇస్తారు సిస్టర్. ఓకే, సిస్టర్ వచ్చేసి ఇప్పుడు ఇంజెక్షన్ వేస్తారు. సరేనా?
మీరు ఇంత మాట్లాడే లోపల పాపకి ఏమైనా అవుతుందేమోనండి.
ఏమీ అవ్వదమ్మా. ఇప్పుడు మేము చూసాం స్కాన్లో, లోపల ఇబ్బందికరంగా అయితే ఏం లేదు, వాపు ఒకటే ఉంది ప్రస్తుతానికి. సరేనా? సో ఇప్పుడు లోపల చేస్తున్నప్పుడు ఏంటంటే ఏ సర్జరీ అయినా సరే కొన్ని ఇబ్బందులు ఉంటాయి. సో ఇందులో వచ్చేసి ఏంటంటే ఏమైనా పక్కన రక్తనాళాలు ఏమైనా డ్యామేజ్ అయ్యే ఛాన్సెస్ ఉన్నాయి. దాని తర్వాత పక్కన పెద్ద పేగు చిన్న పేగుకి లోపల ఓపెన్ చేసిన తర్వాత అపెండిక్స్కి వాటికి ఏమన్నా అతుకుపోయి ఉంటే ఏమైనా ఇబ్బంది రాదు.
ఎందుకు చెప్తున్నారు?
కాకపోతే ఏంటంటే మనకు చాలా ఆపరేషన్స్ చేశాము, ఇబ్బంది ఏం రాదు. కాకపోతే చెప్తున్నాను, ఏ సర్జరీ అయినా సరే కొన్ని ఇబ్బందులు రావచ్చు. సరేనా? ఆపరేషన్ చేసిన తర్వాత కూడా సిస్టర్ ఇంజెక్షన్ ఓకేనా? సో ఏంటంటే ఆపరేషన్ తర్వాత అపెండిక్స్ ఏంటంటే కొంచెం లోపల మోషన్ అంతా ఉంటుంది కాబట్టి ఇన్ఫెక్ట్ అయ్యే ఛాన్సెస్ అయితే ఉంటాయి. కాకపోతే కరెక్ట్గా యాంటీబయాటిక్స్ సూదులన్నీ కరెక్ట్గా వేస్తాము. సో ఏ ఇబ్బంది రాదు. సరేనా? భయపడకండి, ఆపరేషన్ మంచిగా చేస్తాము. ఓకేనా?
సరేనమ్మా, థ్యాంక్ యూ.
Awesome.
I think it was so well done. She convinced the mother that an informed consent has to be taken. She explained the procedure. Okay, I'll ask you. Any comments from you?
Yeah. Hello. First, doctor has not introduced herself.
Okay.
So I am surgeon.
So and so.
I am treating doctor. She has to inform.
Okay.
And one thing I want to tell is we have to, here the child is 10 years, we have to take assent. That is assent of the child is must.
Yes. Yeah.
Well taken. So the first thing is, the first point I take, the doctor has to introduce. Just say your name and tell who you are and all that. Thank you, sir. Any other thing? Any other comments? Yes, ma'am.
So the parent didn't ask that question. I don't know, I didn't understand, follow so much of Telugu. Usually the parent will ask,
What if we don't operate? Can you cure it with medicines? Did she ask that question?
No.
That is a common question. So even if they don't ask, you should tell them what are the alternatives, any method is available, or you say that surgery is only treatment because it can lead to complications. I think that you explained what all complications will occur. That's why she got scared also, I think. So the alternative treatments, whether it's there or not, should be explained. Even if the parents don't ask the question, we are supposed to explain that. But I think beautifully communicated. Of course, you have to introduce yourself like Subramaniam or somebody said that. And I think assent is between 12 and 18 years of age. Right?
Oral easy.
Sir will know best.
Know about it, able to understand from 10 years itself, is it? Okay, my understanding was 12 to 18 was assent. But verbally they should assent for the surgery. Need not be written, but the parent should obviously sign the consent form. Okay, thank you.
Another is aesthetic, like is female patient, no? So aesthetic also, like procedures, as you said, different kinds of procedures.
laparoscopy, did you explain?
No.
Why you didn't think of laparoscopy in a child?
So it's better to, instead of saying I'll make an opening, I'll dissect the colon and all, the kid got scared, right? So you can say that the two options available, one is laparoscopy, another is open. We'll try for laparoscopy. If that doesn't succeed, we'll have to open up. Be ready for both. So that has to be explained. No problem. But here I think it is not so much as a content as to the way you communicate. That was very effectively done. So we will not go into the nitty-gritty of the content. Thank you.
Thank you, ma'am. Thank you.
One more was we wanted to show non-verbal communication also, ma'am. As the doctor was talking, she was patting on the shoulder and she was consoling the mother. So we wanted to show that also.
Yes.
So that was observed. I noticed that. It was like reassuring the mother that nothing is going to happen. Thank you very much. Very well done. We'll go to the last group. First group but last group. But very, very important scenario. Breaking bad news. It's a challenge for all of us. So we'll see how they'll demonstrate.
So our scenario is breaking the bad news. So yeah, we'll be starting. Hello, Mr. Mukesh.
Hello, ma'am.
I'm Dr. Afrin, oncologist.
Yes, ma'am, please.
Would like to have some discussion with you regarding the reports which you have given to us.
Sure, ma'am.
I would like to ask you, would you like to have any of your family members come?
No, it's okay. You can tell to me only.
You can take it. Okay, fine. So do you have any idea for what we have gone through the test?
I think for infection only, ma'am.
Okay, I would have tried. It is not so. We have also gone through the tests and biopsy very clearly, and we happen to found out that it is cancer. Okay?
No, it can be.
Yeah.
No. It can be. I don't drink, I don't smoke. No. Your lab results are wrong.
Yes.
No.
I can understand.
No.
You're going through. I know many of the patients react this way. I'm really sorry for the condition which you are right now. We also hope that it won't be cancer, but we are pretty sure. I'm sorry. We are pretty sure. We have gone through the test many times, and the biopsy clearly shows it is a lung cancer. And
I couldn't. Who will take care of my family, ma'am?
Anybody of your family members, I just have. Please. Mr. Mukesh, you have to control yourself. It's okay. I understand. No, see, it is not that scary as you see in movies, okay? It is not that Mukesh you are. You are not that Mukesh, okay? You are different. So just the name is similar, but you are different Mukesh, okay? Yeah. So, not every cancer is dangerous, okay? Luckily, you are in the early stages of the cancer, so which is having many treatment options, okay? We have a very good team of oncology in this hospital, so we will be handling in a better way.
Thank you, sir.
So I'll be handling it to your oncology team.
My friend, ma'am, you don't have this habit also, this habit. How will getting this, ma'am? One more thing also, when I was seeing the movies also, that Mukesh advertisement is there, you forward that moment, that advertisement, after that we will see the movies, ma'am, together, ma'am. How will you get that, ma'am?
ఫ్యామిలీలో కూడా ఎవరికి లేదు మేడం క్యాన్సర్ ఎలా వచ్చింది మేడం?
See, not everything is genetic, sir. Some cancers will be even sporadic, even without any risk factors also we get. But he is lucky enough that he got his symptoms and immediately he approached the hospital, so he saved himself. Okay, we have cure for this cancer. That is a good thing about it. So, yeah, mostly. Yeah, thank you.
Cost?
This is a free hospital, sir.
Thank you.
I think it was so beautifully done. It is supposed to be a serious scenario, but I think very well done, very well done. Thank you so much, Dr. Ashwin especially. Thank you so much for that. Any inputs for this? Sir? Okay, no Mukesh, okay then. That's okay. Yeah. Any other comments?
So we have to take them in beforehand only. We have to keep a chair for them, ask them to sit. We cannot talk in a corridor. We can take to the room. Otherwise, she has asked anyone with you to I have to family members. No, she asked that. That is good.
So this happened in the counseling room itself.
Okay, so they have assumed the scenario is in a counseling room. Okay, fine. Taken. Well taken. But anyway, in real life, those things have to be taken care of. Ma'am.
So breaking back to something called SPICE protocols. S stands for setting the background. That is, like he said, invite them to sit down, be in a private confidential area, find out which level is coming. The next is perception. What does the patient know? What does the patient suspect? What do you think he or she has got the diagnosis? Then comes the inviting the patient, saying,
What do you think, what are your expectations, or what do you want me to tell you, or what is it that is bothering you? Something like that. That stands for the I. Then K is a knowledge. Exactly what Afreen said, that we have gone through all your tests and then we have come to the conclusion that it seems to be cancer. That is knowledge. Then E is, again it is the expectations and the emotions. So how do you respond to the patient's emotions and the family's emotions? Because that is the most difficult part for the doctor to deal. Delivering the news is, you tell in a very bland statement. But how to react to that, here the patient was so emotional and, breaking down, etc. Then finally, summarizing. Of course, you have to take their questions also, like how she answered about genetics and environment and sporadic cases, etc. The last part is you have to plan properly. So that is the final follow-up. What you do is, what is the plan, what are we going to do, what is the next step, etc. So that is summarizing, planning and follow-up. So SPICE's protocol you use for breaking any bad news, need not be cancer, anything, this applies. So just remember that, and you can Google search and download that mnemonic and remember it when you are trying to break bad news wherever it is. Thank you.
Thank you, ma'am. So now we have learned communication skills through 5 different scenarios. I think there's nothing left to teach. What was the first thing in each of these scenarios now we noticed? What was the first thing which anybody did? Introduction, and you build a rapport. You build a relationship with whomever you are speaking in whatever kind of scenario. So that is the first step in communication, any form of communication. You build a relationship, you get to know the other person. In our case, you get to know the patient or the student, and then go on about it. Now there is, coming to the literature, there is something called as Kalamazoo Declaration. I was so lost in that script of breaking bad news, I didn't realize the projector was closed. So you build according to this Kalamazoo Declaration, there is a checklist which has to be followed Obviously, you can't have a checklist and talk according to the checklist, but there are some general rules. This checklist is also used to assess. It is also used as a tool for assessment. So first step, essentially, you build a relationship, open the discussion, you gather information, like ma'am said, you first judge, you get to know the patient as to how much they know, okay? And then followed by that, you understand the patient's perspective, share information, what you know, you add up that information, reach an agreement, like how she said, like how in that case, in the Breaking Bad News case, it was, you reach an agreement, you tell the cancer is curable, yes, you can take these medicines and it can change. In group, for the internal assessment, they said, I am there with you, you can study, you can pass, we can make this together, we can make it happen together. So like that you reach a common consensus and then you close the discussion. So these are the broad steps of the Kalamazoo Declaration. I'll just show you the checklist. Okay, I think it's too tiny. I'll share it later. We'll move on to the next one. That is learning in the skill lab. Very quickly I'll finish. We'll stick to time. So what is the goal? It's there to provide a structured framework to teach some practical skills in the skill lab. Now we are not talking about simulation scenarios or simulation. We are talking about skills in a skill lab. That means you do it on mannequins. Okay? So the objective is, again the patent's 4-step method comes here. What are they? Demonstration, deconstruction, comprehension and performance. Okay. I want 2 people, preferably a surgeon and another as a student. Surgeon as a teacher and another person as a student. So we have one model from the skill lab, a suturing pad. So I want the teacher to follow those 4 steps and teach the student. Can we do it quickly? Any surgeon, please come forward. Who will be the student?
Anybody come forward as a student? No, nothing to be scared of. Teacher is going to teach you. But she is a surgeon.
The gloves are not there, but you can imitate that you're wearing the gloves and ask him.
Can we start, ma'am?
Keep those 4 steps in mind. Demonstration is that A, B, C which we saw on the board.
Okay.
First you perform the task completely.
Okay.
Next, the learner will
Learner,
attend when you are telling.
Okay.
Third step, the third one is and last will be performance.
మీరు చేసేయండి ఫస్ట్ మీరు చేసేయండి ఎత్తుకొని పెట్టేసాను మీరు చేసేయండి డెమాన్స్ట్రేట్.
Before we start suturing, first you have to scrub, then you should wear some sterile gloves. so we should wear a sterile glove. So after wearing a sterile glove, then we start suturing. So you should take one needle holder and one forceps, and you have to take one suture material. So after wearing a sterile glove and after taking the all required instruments, and you have to take the needle holder should be on the right side, right hand, and with the help of a needle holder you have to load the needle at the junction of 2/3 and 1/3. Okay. Okay.
Just demonstrate.
Okay, so this was step 1.
Yes, ma'am.
Next steps.
No, I have to explain. Yeah. So first you have to, with the help of your right hand, you have to take the first needle holder on the right hand. So you have to keep the thumb and middle finger, ring finger. Then you have to load the needle with the help of a needle holder, and with the help hand of the left hand you have to hold forceps, 2 through forceps. Then, so now I am showing the type of simple suturing. First you should hold the needle at the 2/3 or 1/3 junction of the needle. Then after that there are 2 edges is there. So first you hold the one edge, then you lift the edge, then you have to keep the needle at a perpendicular to the edge, then you have to go in. Then after entering inside, then you again hold the needle with the help of a needle holder. Then again you have to enter at the other side of the edge. Then after that there are 2 limbs are there for the thread, long limb and short limb. The needle should be placed exactly at the middle between the long and short limb. Then you have to take 2 turns. Then after taking the 2 turns, then you have to hold the short limb and you have to pull the short limb to the opposite side. Then now it becomes a surgeon's knot. If you keep on the opposite side, then it will become a some reef knot, so it won't be that much too tight to hold the edges. So definitely our needle holder should be at the in between the short limb and long limb, and you take the short limb to the opposite side. Whichever is there, if it is there on the left side, you take it to the right side, or if it is there on the right side, take it to the left side. So like that you have to take the 3 knots 3 times. Next step. The guidance.
Okay. Yeah, I'm entering from the other edge. Okay, sir,
Ma'am, now I have to describe.
మీరు చేయాలి.
Okay.
I will describe.
He will take.
want one more? And the switcher, this needle should be somewhat big.
Loading the
You take another. Is it big?
This is also small.
Small only.
which one?
No, there is some, yes. We'll do it.
Yeah. Hello. Yeah. Load the needle at the two-third, 1/3 using the needle holder. Then hold at the edge of the skin and enter perpendicularly, right angle, and then enter into the opposite side. Now holding the other edge with the needle forceps, entering the other side. So at the middle of the short limb and long limb, and we have to hold the short limb and we have to bring it to the opposite side. It makes the surgeon's knot. How to tell?
So this is the last step in which the learner is performing the task. Either he is doing it quietly or he can tell how it is done. But they are doing it entirely on their own. Okay, sir. Thank you. I think we can add one more step here. This was performance with guidance, and then last one will be independent performance. Thank you so much, sir. Thank you for the demo. Okay, thank you. So with that, I end this session. So the last session was how to teach skills in a skill lab. So each department, we all know there are so many mannequins in the skill lab, so we can adopt this teaching strategy, and there is a way to assess how we teach in the skill lab, how the student, when the student performs on the mannequins, there is a way to assess it also. We will be dealing with that tomorrow. So these are the benefits of the patent's 4-step method. I think I can stop here. Yeah, thank you. A very small 10-minute session, a continuing of this is the student doctor learner method. Dr. Shravan Deepthi will engage that session. And then we will break for lunch. One more session is there, sorry ma'am. So there is another session on SDL. Thank you.
So, I know everyone are maybe hungry. So, after listening to all the methods of teaching the skills, so before going to one last method, I would like all of you to go into your undergrad days and share your experience of learning in your clinical postings. So, how did your learning happen during your clinical postings? Anyone would like to share? Did you learn? Anyone would like to share your experiences of clinical postings?
We'll go to the ward. They'll ask us to take some case. We will go. We will take the case. We will come back. They'll tell. We will discuss it tomorrow. It's simple.
Great.
Next one.
Any other different experience? Observing. Okay. Any other experiences anyone would like to share?
Demonstration. Teacher. Doctor. At bedside demonstration.
Great. Thank you, sir. So I would like to share my experience of OBG postings. So when we used to have OBG postings, especially in second year, our job was to go to the OPD, go to the patient. We will be given that OP slip. So we write the symptoms and take the patient to the consultant. And then we will be following the consultant throughout the examination. So especially in the gynecology, we used to see the PV, the post-speculum examination, and the doctor used to dictate and we used to write the findings. And OBG again, fundus examination, how many weeks, all those things. So we used to write when mostly postgraduates also will be there. So we used to, as a student, we used to do the documentation. Following that, if the patient get admitted, so every day we will be having wards. So we'll be, even if we are not taking that case, we'll try to just go talk to her, how are you, and then what happened. We were so curious, if it's an obstetric case, we were so curious, like, did that woman got delivered a baby? So I think many of you must have experienced those things. So with that intro, so I'll be talking about the student doctor learner concept of clinical training in the CBME curriculum. So it is similar to what I have explained. So at the end of the session, you will be able to understand what this concept of learner doctor method or student doctor method of learning, clinical training is, and also to implement the LDM in the student training. So as teachers, how are you engaging your students in your clinical posting when they come to your wards? They will follow you in the rounds. Okay, sir. Bedside teaching. Yes, sir. Demonstration of all the signs and symptoms. Yes, sir. Small group discussion. So you take them in the small group and you make them sit in the demo room and you discuss with them some topics. Case presentation. So they will take the case and present and you will be taking the presentation. Bedside classes. Focus group discussions. So will be taken to the OT, OPDs. All the things you are doing, yes. So this learner doctor method is a part of clinical rotations in the MBBS course, where the students will have this longitudinal immersive learning experience in the care of patients in a supervised setting. So the student will start seeing a case in the OPD, will follow the same patient for a period of time till he gets discharged. So what are his signs and symptoms, what was his diagnosis, what investigations the patient have undergone, what was the treatment given, what was the outcome, and then how did he discharge. So a student will be assigned to one case starting from the OPD till the discharge. He will follow the case under the supervision of a faculty. The goal is to understand, the student should be able to understand that longitudinal patient care, and student should also learn how to be a part of healthcare team and to have a hands-on experience of the patients in the OPD settings, inpatient and also outpatient. So the process, initially the student will be assigned to different postings. So we have a clinical rotation schedule starting from phase 2, phase 3 part 1 and phase 3 part 2. Student will be assigned to each department, and the student will be functioning as a member of the healthcare team. And he participates in the pre-specified team activities of the patient care and learning. Finally, he documents the progress and he will be assessed by the teacher. So this is a type of formative assessment. At the end, you can assess the student. So it can start as early as in the phase 2 clinical postings. And a designated faculty member will coordinate and facilitate the activity of students. So each student will be allotted to one specific faculty, and the faculty member is responsible for the care and decision of the patient. So student is not allowed to take independent decisions, so he will be only following. So terminology like shadowing is also there in the US. It's similar to that. So this is a clinical posting schedule. So the students will be going to general medicine, general surgery, OBG, pediatrics, community medicine, ENT and ophtho in the phase 2. So they can start doing this learner doctor method in the phase 2 itself. So as I told, they will be following the patient in the admission day. So this is important. So the student will remain with the admission team until 6 p.m. except for the designated class hours. So after his class, again he is supposed to go back and follow the patient in the wards. And he will be assigned to interview the patient, examine the patient, and work up and follow with the patient under the supervision of the faculty. Additional to the OPD day, they will also be following the patient in the ward rounds in the subsequent days, and they will be following the patient throughout the whole course of hospitalization. So if at all they are undergoing any procedure, any surgery, everything the student will be a part of that during his clinical posting time. And also after the classes, again he will go back and he should look to the patient. And he should present the assigned patient to the supervising physician. At the end, in his logbook there should be there will be a column where he documents everything what he have followed with the patient. So we can do in phase wise. So each phase we can increase the complexity of the task assigned to the students, because in the phase 2 they will be learning the basics of it. So they can start with taking the history, basic physical examination, to assessing the clinical status, how to communicate and how to educate a patient. As they level up, they will be knowing about differential diagnosis, investigations, treatment plans, basic procedures. So, and in the phase 3 part 2, they also can be a part of the decision making and management and the outcomes. So this is the CBME schedule of each phase. What is the focus should be? In phase 1, introduction to hospital environment, early clinical exposure, understanding the perspective of illness, and family adoption program. So the students will be going to even the family adoption program in the first year, phase 1, phase 2 and phase 3 part 1. So in the phase 2, history, clinical examination and assessment of change in clinical status. Phase 3, additional to that, investigations and basic procedures. So phase 3 part 2, decision making, management and outcomes. So here we are linking the learning to the activity. So data gathering can be learned by obtaining the detailed history. Critical thinking and analysis can be developed by trying to arrive at a differential diagnosis. Decision making can be done by asking them to develop a management plan. And system based practice by asking them to write some prescription and the discharge protocols like that. So these are the aspects the student will learn. Student will learn how to communicate with the patient, how to effectively work as a part of team. It will improve his clinical skills and also the system-based practices. So these are some of the snippets of how a student can follow the doctor during the OPDs, and they can go to the daily rounds and they can be a part of the OT team, ICU team, and then be there till the discharges. So it can also be helping for the self-directed learning, where we ask the student to go back. So you see a case in the OPD. So we ask the student to read and come this topic. We'll discuss it in the next day. So it improves the self-directed learning skills and skills for the lifelong learning for the students. So this is an example of a competency. So general medicine 11.7 to elicit and present a case of diabetes. So in the phase 2, they can take the nutrition history, family history and medication history. So we can concentrate more on history taking. So when it comes to phase 3 part 1, we can concentrate more on the risk factors, precipitating factors, lifestyle factors. And in the phase 3 part 2, so the student can be concentrating on the comorbidities in the complexity of the diseases. Similarly, so as the phase progresses, the in detail studying and the complexity of the task increases. So these are some of the examples. So we should choose the competencies that can be most likely to acquire. So this is orthopedician, to take a history after an accident, pediatrics, assessing a child with obesity, and again calculation of BMI, waist hip ratio, and surgery to communicate and counsel patients, families with burns and outcomes. So these can be some examples in different departments. And finally we are doing the assessment. So the formative assessment can be aligned with the competency, the way you teach, the activity done by the student, and you will do the formative assessment by the faculty. So for example, after eliciting the medical history, the student will be eliciting the history and he will be documenting it in the logbook, and then the student should present it to the faculty. So the faculty will be observing how the student is presenting, and the faculty will check the logbook for the entry of those things, and the faculty will be giving the feedback to the student along with the evaluation. So that can be your formative assessment. So these are some examples like how you ask the student to learn, perform, and then you assess the student at the end of the activity. So recognize the importance of patient preference while selecting therapy, and then you ask the students, you discuss various options what can be given to the diabetic patient, and then you check the reflection in the logbook. So this is the template of a logbook, how it goes. So if the student is doing it correctly in the first attempt, you will write first only, F. And if the student needed to repeat, you will write R. If the student is not doing it, you ask the student to go read and come again and redo the thing, then the student have done it in the remedial. And also you will give the scoring like whether the student's performance have met your expectation, is below your expectation, or exceed your expectation. So these are the things we have to enter in the logbook. And decision of the faculty whether you take that competency as complete or he should repeat. And finally, if any feedback we need to give, we will document. So this is how you document the competencies in the logbook. I think many of the pre-paraclinical departments will be doing this on a day-to-day basis in the practicals. What are the responsibilities of the supervising physician? So we should brief the students clearly about the roles and responsibilities. So we should follow the institutional policies with regard to access to documentation, parents' records, and introduce the student to the patient, because directly the student goes and asks, the patient won't talk. So we have to introduce the student to the patient and inform them that the student, please give the history to the student, he will be following you for a period of time, all those things. And we have to respect the patient wish if they do not want the student to be a part of that. And please do not forget that students are not there to provide labor. So please don't utilize this as an opportunity for them to make your work. And do not overburden students. So at a time, a maximum of 2 admitted patients can be assigned to each student. And use methods of work-based learning and assessment while assessing the students, and address the human dimensions of care. So along with the diagnosis, treatment, also try to address the communication aspects of the patient and empathy. So make students learn how to empathize with the patient and how to communicate well with the patients. And ensure that all the activities are performed only under the supervision of the faculty. Ensure that the security of student is the utmost priority, because you are asking them to come again after classes and stay in the ward, talk to patient. So student safety is the faculty's responsibility. And respect time that is allotted. Do not ask student to miss their pre-scheduled classes. So when they have classes, they should be sent for the classes. And in any event of a doubt, follow the hospital rules and regulations. Thank you. Okay, ma'am, sure. So we'll have a group photo session now. So after group photo, we'll disperse for the lunch and join for the sessions after lunch.
fascinating surgeries, which is a very high-fi surgery. We can't get a hands-on training. So at least those rare surgeries they are doing, and so we are practicing it after seeing that.
So just Afrin says some of the surgeries, the patients wants those surgeries, which we don't practice in the run-of-the-mill, and therefore you go to a resource where they've already done and they're demonstrating, and that's how you learn. Anybody else? Any other skill? You learned recently?
Ma'am, for Teachers Day, I have learned dance from the reels.
From the reels. Okay, so she learned quick dance steps by watching reels. So what is common to all this skill learning? So 3 skills we have seen, 4 or 3. One is playing caroms, one is trying to do complex surgeries, another is dancing. What was the main thing that made them do it? What is it called? Interest? Yes. Something beyond interest, what do you call it? Self-motivation, passion, right? Anything else? Any other words? Quickly. Huh? Sorry? Zeal to learn. Yeah, excellent word. Zeal. Z-E-A-L, I think. Yeah. Zeal to learn is a passion to learn, the self-motivation. You are very energized to learn a new thing. Okay? So, hopefully all our students are also thinking on those lines. As teachers, we are still learning some new skills, right? All on our own because all of our own interest. So, what is self-directed learning? So what is, if you look at it, what is the first step? You have to identify your objective or goal. What do you want to learn? Each person said they wanted to learn some particular skill. And how do they do it? Did somebody teach them, come home and teach them how to dance or play caroms? They took their own initiative to find the source of learning, and they have done it. And what do? They practiced it many times before they became, it took some 3-4 months to practice and become good at caroms. So basically, they diagnosed their learning needs. They said, okay, I don't know to play caroms, let me learn how to do it. Formulating learning goals. Okay, in the next 2 months I have to learn it, or in the next 3 months I will watch all these surgeries, and when the patient comes next I should be ready to do the surgery. Identifying human and material resources for learning. All of you did that. You looked at reels. Madam looked at YouTube video. He watched others playing carom. And then choosing and implementing appropriate learning strategies. Okay? Evaluating the learning outcomes. Did you all evaluate your learning outcomes? Did you play in a carom match and win the gold medal? Not yet. What about Afrin? Did you do any complex surgery that went well? Yes, sir? Huh? Very good. Teachers' Day caroms, he got what? Winner. That's all you have to say. Excellent. Super. What about Sri Priya? You got any prize for Teachers' Day? We didn't give you, Very bad. Okay, right. So you have to evaluate the learning outcomes. She got something, you said, Jyoti? You said? Okay, so all this has been described by Malcolm Knowles. Remember, somebody referred to him in the yesterday morning. So why do we need SDL? We'll come back to the medical education curriculum now. No more dancing and carom. Okay, so why do we need SDL in our medical curriculum? Everything cannot be taught. So the first point is vast curriculum. Very right. Any other things? Self-motivation. So we have to motivate the learners. They have to get the self-motivation. We try to push them towards that. Okay? Anything else? Fantastic point. Say it loudly.
Many things are there which our teachers may not teach us. They are master in something. Many things are there in medical field to learn.
So he's very rightly said, medical field is fast expanding. I used to think I know all the aspects of general surgery that I need to teach my students, but then somewhere down the line I learnt I didn't know to do laparoscopic surgery, so this was well close to my professorship that I started learning laparoscopic surgery. So same thing, I cannot teach my PGs if I do not have that skill, right? So all the teachers may not have or may not be able to teach every aspect of the expanding curriculum to the students. So the students will miss out on something, so better to have some kind of a self-directed learning sessions where they will find the resources and try to learn, and we will, what is the word? We will teach or we will do? Facilitate these sessions, okay? And different learning styles. Remember Gautam said that yesterday. Slow learners, what will you do in a lecture? They will be lost, right? So different learning styles will be there and different pace of learning will be there. Some may be very good at picking up, but others may need to read it again once more, reiterate, learn slowly, and you have to update the knowledge as and when. So I may say this is the guidelines given by American College of Surgeons for hernia repair, but there may be some European surgery, College of Hernia Surgery that gives the latest guideline which the student may come and tell me. So remember in the class when the student tells something that you don't know, what should be your answer? You are wrong, I am right? Yeah, the natural ego tendency to say, no, I am right, pa, I think what you are telling is wrong. But you give a patient hearing, say, okay, is that the new guideline? I am not aware of it. Let me go and check it, verify what you are saying is correct, we will discuss it tomorrow. So that's the best way to answer, very gracefully accepting that you may not be aware of some bit of information, that some other students will challenge you, they want to know whether you know this. In first and second year, they may not have really remembered, so it's better to go and give them a case scenario with application of basic science right from the beginning or later on. So there may be cross-linking of context from different subjects, they have to link it. So you will have to help them with some SDL. And we all said in the beginning, Dr. Chittoor has said, what are the principles of adult learning? They're all adult learners. Therefore, they should be able to do a self-directed learning on their own. And they're all global learners. So you have to be updating your knowledge as to what is happening in the rest of the world, and we have to help them do that. Okay, so this is what we already said. So there are some educational theories, don't worry too much about it. There are 3 theories of SDL. Cognitivism theory, which says a learner uses his memory and understanding and pre-existent knowledge to build up the building blocks. Humanism theory is, as he is working as a doctor and dealing with humans, he may be able to learn more. And the constructivism theory says, again, he uses his experience and internal processing to construct new concepts. So if you look at it, it goes back to Kolb's continuum of learning. So this is the Kolb proposed this theory. All students have some kind of experience in learning something when they come to the medical college, right? They have already done 2 years of science in school, and they will observe or they will try to reflect on what they know. They will learn some new thing and learn a new concept. They will experiment with this concept or try to apply this concept in real life. Again, this will add to their experience. So it is experiential learning. You perform, immediate reaction is performance, but long-term reaction is you adapt with this knowledge how to behave or how to behave as a doctor. So this is called Kolb's continuum of learning. Don't worry too much about it. This is all theory of medical education, but this is practically what the student does. So if you look at again the 5 roles of IMG that Dr. Chittoor told yesterday, clinician, leader and member of the healthcare system, communicator, lifelong learner, professional, one more we have added is researcher, okay. So everything if you see, SDL is going to help them achieve all these things, more so the lifelong learner. So if you go into the Indian medical graduate roles, lifelong learner committed to continuous improvement of skills and knowledge. So this is what happens. And SDL is very much in the curriculum. Every year phase, there are so many hours for each subject allocated for self-directed learning sessions. So if you look at the curricular volume, you will find that all these things, pathology has 12 hours, pharmacology, this is for second year timetable, and so on and so forth. See, they have given sports and extracurricular activities 28 hours. All that the students will do very well. Today morning also I had a conversation with Mr. Dilip. He wants some students to be sent for sports competition. I am telling I will check the attendance and IA marks, otherwise I will not send them. So those things they will develop very well, but these things where we have to help them, okay. So sorry about this slide, it's a little dark. So what are the abilities of the self-directed learner? So basically develops a personal learning roadmap, like all three of you just now said, you wanted to learn something, identifying the right learning resources, engage in peer discussions, means you discuss this with your peers also, whether you are learning it right, steer the learning process, understand the future skill requirements, and receive and provide orientation and what and how to learn. So this cycle continues, okay, for any skill, for any of the subject or whatever they want to learn in life. So what are the stages that these self-directed learners go through? Okay, so anybody cannot be a master in self-directed learning. We have to go through some stages. Just like the stages in learner doctor method that Deepthi showed, you find that stage 1. Stage 1, student is fresh into first MBBS, still a little more dependent than what you think. So what should the teacher be? You can't be a facilitator straight away. You have to be an authority. You should coach them. That's what most of the phase 1 teachers do. Really, somebody was talking about spoon feeding. I call it anda feeding. Anda in Tamil means it's a big vessel. You pour the whole content into their mouth. Okay, that's what we do, and that's what you should do, because that's how they will be able to adjust. They can't learn so much at one go. So what happens? Coaching with immediate feedback, it's almost like a drill, and you try to overcome the deficiency and the resistance of the students. Okay, stage 2 is they show a little more interest, so you have to be a motivator and a guide. You give inspiring lectures, make it interactive lectures, guided discussions, help them in goal setting and learning strategies. Again, tomorrow Jyoti is going to talk to us about mentoring. Mentoring, mentors, if you look at it, mentor can be any of these things, right? And stage 3 is they are very much involved. You act like a facilitator now. So discussion is facilitated by a teacher who participates as equal. So that's why third year you start giving them seminars and group projects, etc. Not that the first years cannot do projects, but they need a lot more pushing. By the time they come to third year, they are okay with it. Stage 4 is self-directed. They are almost like a consultant. All of them start watching Maro videos. Okay? And then they say, this teacher missed out all these points, so you guys go and read this, watch this video, it will be much better. Okay? So they are consultant and delegator. So basically internship, they are able to do dissertation or small projects. They do work in a group, and group studies they are able to do on their own. So if you again look at the stages, the same thing, the SDL skills develop over the years. Same thing I've said, first year this is there, second and third year happens, and the fourth year and the intern, they become truly self-directed. By the time they know which entrance exam to write, whether to do NEET PG, whether to take PLAB, US, whichever, they try to take our advice, try to meet people who come from abroad visiting the campus. So they are very much self-directed. So this is called the gross model of SDL. Somebody called, I think it's John Grow, who described this model of self-directed learning. So how do you conduct SDL? Okay, quickly, if I ask you to plan and conduct a SDL in your own subject, how are you doing it currently? Somebody can quickly tell me. So you plan the topic or students ask for the topic? That is the first question. So how do you choose the topic? It's a matter of debate, it's a matter of talking between the students and you and finding out. So what usually, I don't know, my way of looking at it is, some of the topics or subtopics or sub-competencies that, like you said, you may not have enough time to fully teach that, and you think it is not very much core, or sometimes very core topics that the student is unable to understand very easily in a 1 hour lecture. You can have another 2 hours or 1 hour SDL session. So you have to decide which competency, which topic. Yes, that's the first step. Second step. Okay, again the learning objectives. The learning objectives, we will see 2 ways it can be done. I give them the learning objectives, or they will formulate their own learning objectives. It depends on the group and depends on the stage in which the learner is, like I showed you. Okay, so next is the learning objectives. Then I want somebody else other than Savita to answer. What is the next one? Sorry? Very good. So identify the learning resources and materials. Very good. Next. Allotting the time, most important in the timetable. Okay. So you have to plan, and already hours, total hours for each subject is given. How you want to distribute it, which part of the day, which day of the week. If you keep it on Saturday, everybody will disappear after lunch. Saturday afternoon is a wrong time to keep SDL, both for the teacher and the student, I'm telling. It's not only for the students, right? So, I mean, it depends on each department, how many faculty are there. You have to allot the timetable. It's a very, very important decision that you have to make right in the beginning. Then, anything else? We'll ask the men in black. There are 2 here, 5 here, 3 here. And sir also I can consider partly in black. Huh?
Dividing the time.
Dividing the time. How?
Once you allocate, like, you have.
Suppose I say 2 hours session. How will you split the session? Oh, you want to do more than one topic in one session. Likewise you're telling. Okay, it can be that way also. If there are small bits of topics, then you can even cover 2 or 3. Divide them and. Very good. Okay, so that depends again. You topic into subtopic, subtopic into learning objectives. You looking at the notes and telling? No, no notes, only AI and chat GPT in the mind. Very good. That's nice. No, I am very happy. Right. So you have to do that. Anything else after that? Okay. You have to plan the session. Assignment and assessment. Okay. You plan when to evaluate these students. You should give them time to read. No. You can't give the learning resources 10 chapters and 10 articles and say, I'm going to assess at the end of half an hour. So how do you plan it? Okay. So the overall structure is fantastic. But before that, you all know what is SDL. Does a student know what is SDL? The most confused terminology is, one is self-directed learning, another is self-study. Same or different? How is it different? Huh? No, self-study means what? They study on their own, whatever they want to study. You are not aware what they are studying. You just tell them today is self-study hour. You all sit inside the class and read. I am going. Okay? Self-study is something they do on their own. What is self-directed learning is, as the word indicates, is directed by us. We all become directors. Oscar winners maybe. Okay? So you have to direct the path, like how you all said, how to divide the session, time, topic, learning objectives, learning material resources. That is what is most important. So you have to start with sensitizing the students and the faculty about how to do an SDL and what is the importance of it. So before you have to plan the session, as you all very nicely said. So faculty training, everything you have told me, orientation of students, gathering resources, venue, timetable. Most important is, if you want to give e-learning resources, you have to have a Wi-Fi connection. You should have Vijay here helping us, not watching any movie on the phone. Okay? And then formation, you can even have an online continuous discussion, WhatsApp group. I'm sure many of the departments have WhatsApp group, you send assignments on it. Distributing pre-session logistic material to the students. So this is a publication by Dinesh Badyal et al. In 2020 about self-directed learning. Actually, sir is one of the best proponents of it and the best way he practices. I'm trying to get him here to do a workshop for us on SDL. Okay, so he said these people did a lot of trial and error method in CMC Ludhiana, and then they have come with this. So they divided into 2 sessions, 2 weeks apart. The first session is 1 hour or 2 hours, depending on whichever topic you want to, and the second session is again 1 hour, 2 weeks later. So what happens is, the first session, 10 minutes instruction to you divide them into small groups as somebody told, and then you give 10 minutes instruction to the students. 20 minutes you set the learning goals. You give the topic or subtopic and you can ask them what you want to learn about this topic. So they will contribute some objectives. You can add the remaining objectives. Then this is 30 minutes. The next 30 minutes, the facilitator helps in planning and finding resources and the group disassemble. So 1 hour session is over. Then what happens is, after 1 to 2 weeks, in the intervening 1 to 2 weeks, student finds resources, reads, they contact the facilitator for guidance, he gives feedback, engages in, and makes sure they are learning in the 1 to 2 weeks gap. Then the next session is 2 weeks later or 1 week later, again 60-minute session, 30 minutes is for debriefing and learning opportunities. They tell the teacher what all they have learned, and 30 minutes is evaluation of learning. you can have a mini small assessment then, and then you give tips for both the faculty members and the students how to improvise the session or how to improvise the learning. So this is a classical system in which where self-directed learning is done, and this has been tested and proved to be quite effective. Okay, so if you look at this timetable, don't worry about this. This is Friday. Again, they have kept it on Friday afternoon last session. Okay, 1 hour is in general medicine. The topic is something to do with blood loss and shock, and so this 1 hour is done for preparing all the materials, whatever I told you. This is session 1. Then the real SDL period is the 2 weeks or the 1 week in between. I think they take it after 1 week, yeah. So 8th Friday was the one the topic was allotted, all the material was given. Then 1 week later, the next Friday, 15th, again afternoon 1 session, they sit and resolve the case or debrief and get what the learning and evaluate the learning. So this is what is very important. So when you use this, you can have any kind of learning. It can be a PBL, problem-based learning, case-based learning, e-learning. Even in AdCom, morning Dr. Sridhar was talking about AdCom. AdCom clearly gives you guidelines. You can do an SDL session also in AdCom. Okay, bedside teaching, PG teaching, anything you can do. So if you look at this module 1.1, what does it mean to be a doctor? If you look at it carefully, it says 2 hours is self-directed learning. He's already given you the formula how to do it. So it's very easy. And then this is the learning goals for the self-directed learning, what all they have to do during that time is also given very clearly. So already some documents are there, you can follow it, or you can create your own documents. A lot of digital tools, we just saw all those things, right? And simulated patients, everything is there, peers, self-assessment, online quiz. So for facilitators, we should be aware of all these things. You should be willing to search for the students and share it, online resources, you monitor their use and use online tools in debriefing, assess for assessment. So recently they did a Kahoot quiz in microbiology department. So you can use these kind of things to make the assessment also very interesting, and students will prepare better and come, right? So assessment can be done at 2 stages. Assessment of learning, what is that called? What is assessment for learning? Assessment of learning. Yesterday afternoon session, post lunch, everybody is deeply sonorous. Assessment, how much you know? Assessment, usually assessment for learning is usually a formative assessment. Assessment of learning is summative assessment. Okay, that is the meaning, but here we have not used it in that context. We have just one topic conclusion is usually for formative assessment. You can use any of these type of assessment skills. Tomorrow we are going to discuss this. And how is the SDL program going on in your department? You can do it after only few SDL sessions have been done. Then you can do it by getting feedback from the students, faculty. How do they perform in the test at the end of the monthly test? Has the SDL helped them? All those things you can assess at the end of the couple of SDLs. Okay, now I will just briefly share one SDL that I had prepared. Then I am going to give you a homework and I will stop there, right? Then we will go to the next session. The Word document Yeah, okay. So this is an SDL plan for in the Department of Medicine, diagnosis and management of Cushing syndrome. So Cushing syndrome, any physicians here other than pediatricians? Pediatrician is there. How important is Cushing syndrome? Is it core or non-core in your curriculum? Huh? Non-core. Okay, you may not have an essay on Cushing syndrome in pediatrics or general medicine paper. You may have it in hypertension, coronary artery disease, or diabetes mellitus and things like that. So this is one ideal topic you can do an SDL, because you need not spend so many hours teaching them on Cushing syndrome. So if you look at this, these are the learning objectives, but let me show. So these are the learning resources that I have shared with the students. So many of them are journal articles, But there is one, again it is, you are referring to the endocrine system, there is one book also, and at the end of it I will show one, you can share some YouTube resources also. There is a YouTube site called Osmosis, many of you would have said. It's a very tacky way and a very interesting way of giving facts. So a lot of students use it. So I have attached that one YouTube video on Cushing syndrome for them to go through it. Instead of reading books, they can look at it also. And you have to give resources that has been tested and you have gone through it and you find that is appropriate. Don't give inappropriate resources just because you have to give a YouTube resource. Okay, so this is okay. How do I scroll very fast? Okay, so this is a pre-session, is the first session. That is a 1 hour session, I said no. So diagnosis and management of Cushing syndrome is the topic. Target learners, we will take it only as phase 3 final year MBBS students, leave the BDS. Number of learners, remember that. You are dividing them into 5 groups, at least 3 you should have. What are the specific learning objectives? I have written all the objectives, you discuss with the students and add or subtract some of the objectives. Okay, so these are the objectives, I am not reading it out. Then faculty training. Prior to this, we have done a faculty development workshop on SDL. So whoever faculty involved are trained in SDL. Half a day workshop is enough. Students are also sensitized. This can be done by faculty along with some interns or postgraduates during a medicine lecture class prior to starting the SDL. Okay. Teaching learning method is problem-based learning. So 2 sessions. Session 1 is on Monday afternoon 1 to 2 p.m. Session 2 is next Monday afternoon 2 to 4 p.m. I am giving 2 hours for the debriefing session, the second session. Okay. So you introduce a topic, same way, 10 minutes, and then I also give a pre-test to find out what is a pre-existent knowledge about the Cushing syndrome. Then you develop the learning objectives. And then you find out the resources and then you share it with them. Session 2, same thing. Okay. In this case, teaching age you have to find out. So a paper case of a 64-year-old lady with worsening state of diabetes mellitus and hypertension with recent onset of easy bruising is given. That is a clue that this patient may be developing Cushing syndrome. So you give a case-based, problem-based learning, and that's how you conduct the session. Session 1, session 2, they come after 1 week. You give an immediate post-test MCQ, and then you evaluate the thing, and this is the, anyway we can't do this, we have internet but doesn't matter, I don't want to waste the time. So this is how the session is done. We'll go back to the PPT. Okay, just take a screenshot of the next slide that I'm going to show you. This is going to be the homework for each group. Tomorrow you will present it. Okay, so each group select a subtopic from the competency that you have already decided. Yesterday for the learning objectives, right? Each group has decided on a competency which Dr. Adiga sir has posted in the group also. The same competency, you choose a subtopic already chosen that is appropriate for SDL. Then you design a SDL session under these subtopics. You please take a screenshot. I'm not going to read it out. Okay. Have you taken the screenshot? At least one group member? Can you take a screenshot? Shall I move? All of you have taken? Okay. So again, try to be a facilitator for these SDL sessions and not you have to be a guide by the side, as I told yesterday. What are the benefits? You all know it promotes independence, enhances critical thinking, fosters curiosity, facilitates personalized learning, and prepares students for the future. So again, I found this very nice in the Google is 3 L's of self-directed learning. You have to do lifelong learning. How will you do? You should have labor plus love. That means you should have the zeal that Sai Krishna just told us, the enthusiasm, the passion for it. You should use it as a leverage. Leverage means you use the new learning to promote your own career, to promote your own self. Like Afreen said, she'll watch complex surgeries. She will do complex surgeries now and her level of surgery is going to go up. She's going to be recognized for that. Likewise, already our sir is Carom champion now. They're going to call for the national Carom championship. He is going to enroll for it. And Sri Priya will maybe learn classical dance and enjoy the whole thing. So, you have to use it as a leverage to go to the next level by whatever you learn through SDL. So 3 L's of self-directed learning. Okay, these are the suggested readings given by the NMC website, and I thank the NMC Executive Committee on FDP for the slides which I had modified a little bit. Thank you very much for the patient hearing. But please be prepared with this work. Tomorrow you are supposed to present it along with the remaining work. Okay, thank you.
Hello, 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 hello.
I hope all of you have derived the specific learning objectives and teaching learning methods. Isn't it? After that, what is the next step? Yeah, you have to prepare assessment questionnaire. Before preparing assessment questionnaire, anything? You want collar mic, sir? Is it fine or collar mic? Not audible. That is. Are you familiar about blueprinting? Huh? Are you? For any exam questionnaire when you are setting, any exam question paper, the blueprinting is essential. Why it is essential? So if you can follow the blueprinting, that it is there what are the competencies, what weightage should be given for each competency is very essential. According to that weightage for the competency, we should prepare the questions. If you don't give the proper weightage for the competency, what will do after some time? The students may think this is not important, then they will not focus on that one. See, always students will see what are the previous question papers they check, what questions they are asking. They will focus on them rather than, that's why if you don't ask any questions, they don't learn. That means you have to try to, whatever it is, you try to teach, means assess every competency. You give the proper weightage for every competency. If you don't give that weightage, next year batch students, they don't give much importance to that particular competency. Okay. So today's can see the not moving. Okay, explain the blueprinting of assessment and its importance. That's what I am telling, blueprinting of assessment and its importance. And design theory and practical or clinical exam. Then of course, write an appropriate essay question. You know the question paper pattern you have to see, you might have seen. There are essay questions are there, short questions, 5 marks questions are there. Even essay questions, there are the modified essay questions they are asking. You know what is modified essay questions? The clinical scenario will be there, then they are framing the questions. Other one is the actually structured MCQ, essay questions they are asking. You cannot use the old pattern, the write an essay on iron deficiency, anemia, like that you cannot ask them. Now you have to, any essay question or short question should be either structured or can say, as I told you, modified. Modified in the sense, the clinical scenario based MCQs have to make, essay questions have to make. Either long essay questions or short essay questions. So 2 patterns, either the structured essay questions or the modified essay questions. Means here the clinical scenario you are using. Nowadays you might have seen most of the time, at least one essay question they are asking the modified essay question on the basis of the clinical scenario. Other one is a structured essay question they are asking. Among the short questions, you might have seen at least minimum 2 or 3. What type of modified essay, short essay questions will be there, or clinical scenario based. So that's what, write an appropriate essay, long essay questions, structured and modified, and short essay questions, structured and modified here. So both you should know how to prepare the structured long essay question and structured short essay question. Similarly, structured short essay questions. Okay, write an appropriate this one, reasoning questions, restricted response essays or short answer questions also, you should know how to frame. Merits and demerits of essay questions and short answered questions. So you can see the assessment method. As I told you, the assessment drives, what is this? Jump pipe in the complete, yeah? Any kill? నేను పెట్లేదు ముందు ఇంకా ముందు ఒక నేను ఏం మూవ్ కావడం లేదు. Okay. So assessment drives learning. Will you agree or not? If you don't assess, you don't learn about this one. That's what I was telling. So students look at the previous question papers as guidance for what to learn. Students focus only on topics to be tested. If you are not testing or not assessing, they don't learn that one. So that's why the important here. Assessment method should be based on SLO and teaching learning method. As I told you, SLOs, specific learning objectives, if you prepare for any competency, each competency you have to make certain specific learning objectives. These specific learning objectives can be utilized not only to frame the structured essay question or structured long essay question or short essay question or maybe even reasoning questions or maybe even MCQs, even Viva questions can be depends on these specific learning objectives. That's what every topic you are chosen, you have to generate the specific learning objectives. So these specific learning objectives will give idea how to make questions, means assessment questionnaire also. So now you can see this diagram here. Intended outcome, competency, the learning objectives will be there, learning methods. Now assessment methods depends on these learning objectives and also learning methods. Learning methods means suppose certain learning methods lab based, so the assessment methods will be different, isn't it? So no single method is appropriate for assessment of all the skills, knowledge, attitude, okay. So combination of assessment techniques like essay question, MCQ, OSP, OSCE, DOPS, mini-sex all are required. All these tools we are using in assessment. Because now I am focusing only on MCQs and essay questions. Other things I am not discussing in detail. Blueprinting. First of all, you should understand what is the blueprinting. Blueprinting for just I gave the example here, the blueprinting for general medicine, that will give some idea about what blueprinting is. The planning of the test against the SLOs and competencies is essential. Planning, the blueprinting is nothing but the planning of how, what extent, what weightage should be given for each topic in your particular subject. For example, you can see it will guide you, create the balanced examination. A test blueprint consists of list of the competencies. So for example, here in the general medicine, you know about the cardiovascular. Of course, cardiovascular system, there are many cardiovascular disorders will be there. Similarly, nephrology, many nephrology conditions will be there, whatever it may be. So all these cardiovascular disorders, can see the health maintenance, the weightage is given like this. Mechanism of disease, this weightage. This is the differential diagnosis and diagnosis, this weightage, and management like this. Like that, cardiovascular system, the competency of all the cardiovascular disorders, you are giving weightage about, out of 140 marks, you are giving 25 marks. Nephrology, you are giving this. So like that, first you should have the blueprinting like this. Okay, then, So after choosing the topic, suppose in cardiovascular system, you want to choose from cardiovascular system, topic is hypertension. Then you want to choose the topic is hypertension. That means here cardiovascular system, hypertension. There are many other diseases may be there. You are choosing the hypertension. Context, you are choosing the therapy here. The management, you are choosing the therapy. And so like that, so you are making some of the either essay question or short or long essay questions, whatever it may be. At the end, like that, you are making the theory paper. Suppose theory paper, sometimes if it is not covering this many weightage, about 25 marks are there, but in cardiovascular system, the theory questions are covering only 20 marks. Remaining 5 marks, you can consider, you can go for the MCQs. Like that, always you have to see the balancing about this assessment. So long essay questions, can say the structured essay questions. In the structured essay questions, there are many restricted response essays may be there. Short essay questions, means short answer questions may be there. You might have seen any essay questions. They may be, in case of pharmacology, classify drugs in treatment of the hypertension. So like that, so there may be some of the many restricted, or maybe explain the mechanism of action of lisinopril. That's what can say that, and many RREs, restricted response essays, or short answer questions may be there in structured essay question. You cannot ask, please remember, you cannot ask the question, write an essay on the drugs used in treatment of hypertension. That is not correct. You have to specify what actually you want. So that's what the structured questions you should frame in any essay question. Then modified essay question. I will show you the example of modified essay question later. Avoid traditional open-ended long essay questions. You should never use the open-ended long essay questions in assessment. That is olden days when we are doing even easy examination. They used to ask one essay question for 3 hours. Such type of essay questions we should not, even 1 hour essay questions they used to ask earlier, but now that is obsolete. Short essay questions, we can say the short structured questions or short modified essay questions. Structured, modified, here also structured and modified we can use. Restricted response essays. Avoid write short notes on, write briefly, you should never use. Add a note, you should never use, because nowadays many papers they are using this word. Write short notes on, write briefly, add a note. Such things should be avoided, because the student will be confused what he has to write that one. You have to give clearly what he is supposed to write. Single best answer, multiple choice questions. So 30% you can ask for the recall type, and remaining 70% of MCQs should be assess higher level knowledge, concept based or problem solving or data interpretation or decision making, like that. You cannot, nowadays you can see some of the examination, many recall type MCQs will be there. That should be reduced. So of course this is the designing practical exam. You can go for the OSPI, objective structured practical exam, DOPS, direct observation of the procedural skills, work-based assessment and clinical exam, clinicals, OSCE, mini-sex and DOPS. These are some of the assessment methods, but of course I don't want to discuss all those things. I think might have discussed earlier, isn't it? These are some of the methods. Tomorrow, okay. Yeah. Characteristic of assessment tool. So what is in validity? Of course, Dr. Chittoor was telling about this one. 3 important, the basic characteristics about the core pillars of the good assessment tool. The assessment tool should it should be fulfill these 3 criteria: validity, reliability, and objectivity. And also some of the other things also we can see the authenticity reflects the real life, that is clinical scenarios also you can incorporate in assessment tool. And transparency, that means here you can say clear instructions and scoring, that is very, very important, especially in essay questions or short questions, whatever it is. What is the scoring for each component of the structured question? Each component, how many marks? That is very important here. Criteria for instructions and scoring, and also the educational impact promotes the question should promote and guide the very effective learning. Okay. So now we'll go to the essay question. Criteria of good essay question. First of all, you see, first of all, what is essay question? Any planned piece of written coursework which is submitted for assessment is the essay question. So here you can see that based on Stalnacker's definition, an essay question should meet this following criteria. Number 1, requires examinees to compose rather than select the responses. In MCQs you are selecting, you are not composing, isn't it? But in the theory essay questions, examinees to compose rather than select their responses. Second one is elicits student responses that must consist of more than one sentence. Why they use the more than one sentence? Because some short essay questions also are there. There may be, they may not be very big. So in that way, then allow different original responses and pattern of responses, and requires here the judgment. Of course, the particular specialist, of course, the specialist is required to judge these answers. You cannot correct, suppose your conduct examination, you cannot give to the tutor or some other person to correct your paper, because they cannot assess properly. That's what here requires, subject to judgment by the competent specialist to judge the accuracy and quality of the response. So then clearly, of course, as I mentioned here, clearly define, first of all, before making an essay question, whatever it may be, first of all you have to define the specific learning objectives. So all the questions you are framing on the basis of this specific learning objective. That's what here, begin with the specific learning objective also will begin with directive verb and describes the observable behavior or action that students should demonstrate. So even so, that is a specific learning objective, both these components are there. Now here you are framing the question to see whether student is able to, that particular objective has fulfilled or not. So you can frame the essay question or whatever it may be on the basis of specific learning objective. Avoid using essay questions for intended learning. That is of course, if you can assess through MCQs or some other ways. You don't make essay questions from such topics. So now you can see how to construct the best thing is to define task and problem should be there in all the essay questions. What is the task? Define the task and shape of the problem or situation. So task is the explain. The problem is the key elements of the essay. For example here, explain the mechanism of action, therapeutic uses, adverse effects and contraindications of enalapril. So this is the problem here. So here the explain is the directive verb. So avoid, because this verb is very, very important. Task verb is very, very important. You have to use the right verb. So for example, you cannot use the appreciate, consider or discuss, or sometimes this type of should be avoided. So based on the intended specific learning objectives, so the problem should be based on SLO. That's what, based on intended specific learning objective to be assessed, and it should be provide the structure and focus to the responses. That's what I was telling. You cannot blindly ask. You should provide the structure, and that's what structured essay questions. Structured. Now there will be more focus. If you can put the structured essay questions, there each component is the different components will be there. The structured question, so the student can answer. The student knows what to answer. If you ask the traditional essay question, sometimes student will get dilemma what to write. He may be knowing the entire topic, but he may be in dilemma what to write. A developed problem situation should assess the same intended specific learning objectives. Means whatever problem you are putting in essay question, that should be able to address the same intended, that means should assess the same, the SLO, what you wanted to assess. You see here the intended learning outcome is the analyze impact of America at war on American economy. So this particular question, you can see the essay question, describe the impact of America at war on American economy. This is less effective. If you want to make it more effective, what you can write, analyze the impact of America at war on American economy by describing how different effects of the war work together to influence the economy. That means now this question is more focused. First question is not focused. So that's what you try to, whatever generate the structured question should be more focused. Clearly define the task. Define the task means what is the task here? Describe. Clearly develop the problem and problem situation and delimit the scope of the task. That's what here. Here this one is the reducing the task here. We are focusing what exactly you want. Like that you have to frame the question here. Delimit. That's what delimit the scope of the task. This is again example of the evaluating essay question. You can see how the less focused essay question. Here slightly little more focused essay question. It is little more, much more than this focused essay question, and this is definitely much more than focused essay question. Like that, you should delimit the scope here. So then the student can write. So any essay question we are developing, don't write blindly. Write an essay question like that. You try to go. What is a structured question? You should frame like this. See, that's what now I am doing. Use several relatively short essay questions rather than one long one. One long one. What is the advantage of this one? Suppose the short essay questions are better suited to assess the depth of student learning. Will you agree or not? Short essay questions, because one single long essay question, so you cannot assess the complete. It may be only the certain aspect of the topic only it covers. But like that here, short essay questions are better suited to assess depth of student learning within the subject, whereas longer essay questions are better suited to assess the breadth of the student learning. That's why nowadays anyway you can see our examination pattern also. There are some of the 5 marks questions, some of there are short essay question type only. Using several short essays also help to cover the subject, and short essay questions are easier to score than the long essay questions. And avoid use optional questions. Of course, we are not giving any choice here, but actually the option if we give, it is not good. Anyway, in medical, I will skip this one. Avoid using the optional subjects. Students may waste the time deciding which question to answer. And some questions are, suppose 2 questions are there, one may be more difficult one, other one may be easier one. If the student chooses the difficult one, so finally he will get the less marks, isn't it? So that's what options in examination should be avoided, especially in medical subject. So helpful instructions, specify the relative point value and appropriate time limit to clear directions. For example, here the 80 marks question. How much time you are giving? 80 mark theory paper, 160 minutes, isn't it? Sorry, 102. Yeah. So means 160 minutes. 80 marks, 160 minutes. That means each mark 2 minutes. So roughly, while making the question, you see any essay question, 15 marks essay question is there, you try to assess whether student will be able to answer this question in 30 minutes. Because you are giving that 15 marks, so weightage should be given each mark 2 minutes. So roughly you should plan the question that should be answered within 30 minutes. State the criteria for grading. Point value for the content and form. Because I told you structured questions. Each component of the structured question, there may be certain marks. And that you have to mention each component how many marks. State the criteria for grading, point value for content and form. Improve the essay question through preview and review. So now this is very, very important. Can see the preview. What is the preview? Predict student responses. While making the question, the blindly, whether your student will be able to answer or not, that you have to predict. It is important. You have to predict the student responses and write a model answer. Then only, so suppose simply you are making the question and whether if the teacher himself is not able to give the correct answer, such questions should be avoided. That's what here. Write the predict student responses, write a model answer, the model answer gives reflection on the clarity of the essay question. Please remember here, well, if you make the model answer, that will give clarity. That will give the reflection on the clarity of the essay question. Serves as the basis for the grading of student responses. The model answer, whoever is correcting the paper, so it will serve as a basis for the correction. Then helps to check its alignments, whether the answers what you are about this question, you can check whether it is aligning with the SLO. Then ask your colleague to critically review essay question, model answer, not only essay question, model answer and intended specific learning objective for alignment. All the three things you have to, you prepared the question, but you prepared the model answer, give it to your colleague and check whether this is the review for the essay, the question, model answer and intended SLOs. So this is after examination. After conducting examination, again you have to review the range of student responses to the essay. So where the students, what many students may be doing certain mistakes, so why they are making a review, how they have interpreted your question, you have to review. Then make revisions in the question accordingly. Next time when the students are not able to understand your question properly, then you have to change it in next time. Advantages of essay questions: provide an effective way of assessing complex learning objectives, allow students to demonstrate their reasoning, provide authentic experience. The constructed responses are closer to real life than selected responses. Limitations. Now you see the limitations of essay questions. There are quite a number of limitations are there. Test limited sample of the subject. Will you agree or not? Essay question can only, you cannot cover, suppose whatever in this cardiovascular system, you can cover only certain, you can test limited some less content validity. The next is the less validity and objectivity. If the question is not framed well, it will not serve the validity and objectivity. Difficulty in assessment. Of course, MCQs is very easy, isn't it? MCQs, the moment you give, mission is there, MCQ bubble, within no time you can assess the MCQ exam. But here, it takes, if it is 150 and 250 students are there, it will take very long time to assess. Difficulty in assessment, and reliability in scoring is less. Reliability in scoring, will agree or not? Some people, if they are in different mood, they can give suppose sometimes more marks and sometimes less marks, and scoring is, the reliability in scoring is less. MCQs, that problem is not there. The scoring will be perfect there. And time consuming for answering and also scoring, both is the, and subjectivity in assessment. Suppose while correcting, if you know this student is a bright student, automatically without seeing the content what he has written, you may give more marks. Suppose if you know this student is a weak student, he might have written the correct answer, but you think that is the halo, positive response, and horn, negative effects also will be there. The subjectivity will be there in assessment. And provide practice in poor and unpolished writing. Nowadays, I think you have seen some of the students, if they don't know answer, they fill the paper and without thinking, they write in such a way, we cannot read and understand what he has written. So they will practice that one. That's what here essay could provide, practice in poor and unpolished writing. And so we can overcome all these limitations by using structured essay questions, modified essay questions, and restricted response essays. We can minimize some of these limitations. That's what I am telling you. If we can frame the questions, structured questions or modified essay questions or RREs, whatever it may be, we can overcome some of these limitations of essay questions. So common misconceptions of essay questions, many people think they assess higher order thinking. It is not actually MCQs. If you frame properly, you can assess the higher order knowledge more perfectly than this essay. So easy to construct, because it is not, many things like essay questions construction is easy. But see, if you just write an essay on that one, that may be easy, but that is not the correct way. So EQ essay questions that are hastily constructed without much thought and review usually function poorly, and eliminates the problem of guessing, and also that is not true, and encourage students to prepare more thoroughly. This also not, nowadays if essay questions are there on the written part, means they go now as a small textbooks are there, guide type of textbooks. The whole time they will just memorize and write the exam, but they may not have any concept, they cannot explain anything. That's what actually essay questions, this is students to prepare more thoroughly. Actually MCQ, if you conduct the MCQ examination, the student has to prepare more thoroughly. Theory exam, essay questions, they will go selected questions, how they are asking, they will just focus on that one, and if they get that question, they will be they can answer, otherwise they may not able to answer. Okay, review and write an essay on, you can see some of the question, critique, review the essay question, write an essay on protein energy malnutrition, discuss the universal immunization program. What is your comment on this? These two questions. They are less effect, unfocused here. They are not focused, they are not structured. Will you agree or not? They are not structured, not focused. There was definitely this type of MCQ essay questions are less effective in assessment. They are not suitable to assess students properly. So now you can see the same essay question. You can see, write an essay on protein energy malnutrition covering the causes, classification, clinical diagnosis and initial management in the hospital. Now it is more structured. So now it is more structured. Similarly, can see the universal immunization program in the context of its objectivity, operationalization, targets and limitation. Like that, you have to give the what exactly you are expecting. Should be more focused.
Make one each group to make a structured essay question.
Yeah. Okay. We'll type of, no, what do you mean I'm projecting?
project it and then you can discuss.
Yeah. Okay, type of essay questions, long essay questions, structured essay questions. Structured essay questions contain many short answer questions or restricted response essays on single problem okay, then modified essay questions and restricted response essays. So traditional essay question, for example, you can see the long essay discuss iron deficiency anemia. So it's a traditional long essay question, but you can say structured essay question, how we can mention the etiology of iron deficiency anemia, list clinical features of iron deficiency anemia, indicate lab investigation. So like this, now you are giving the marks also. Each component you are giving the marks. So this is a more structured, isn't it? Just see the compare this and compare this one, which is more effective. Here is a more structured, and each component, how many marks also are there. Students can get the correct picture about what to write. Modified essay question. So here the clinical scenario you give like this. Of course nowadays we are asking. You can say the questions you can frame. So depending on 10 marks if we say, so give the scenario like this. How does nebular control external angina? How does control hypertension? Like that, whatever you want to ask. Now the case-based learning is a modified essay questions. Now you know that most of the question papers, they are giving these modified essay questions, either long essay questions or short essay questions. Suggestions for grading. మీరేం చెప్పింది నాకు
వాళ్ళకి జస్ట్ ఒక స్ట్రక్చర్డ్ ఒక ఎస్ఏ క్వశ్చన్ని ఒక్కొక్క గ్రూప్ని ప్రిపేర్ చేయమని చెప్పండి. మీరు ఆల్రెడీ చెప్పారు కదా, సో దట్ ఇంటరాక్షన్ ఉంటుంది వాళ్ళలో.
కాదు, నెక్స్ట్ టుమారో కదా అదే సాధ్యం చెప్తాం. ఇప్పుడు టైం ఆడుంది. You see the suggestions for grading of the essay questions. Can say first go through the model answer. Whoever is model answer, any questions before assessment, you have to make the model answers. That is very, very important. Nowadays we are not doing that one, but you have to do that one. Any exam questions you are making, you have to make the model answers. So first go through the model answer. Then check the scoring key against the actual responses. What is the scoring key? Then be consistent in your grading. That means you have to use some criteria. What is the, suppose if it is written, how many marks? If this is written, how many marks? Some criteria you should follow like that. Then grade only one question at a time for all the papers. What is the importance here? One question at a time. If you are correcting 5 students today all the questions, and tomorrow we are correcting the others, that cannot be, assessment may not be proper here. So it is better, so grade only one question at a time for all the papers. That is one of the suggestion. And grade the responses anonymously. You should not know which student's paper it is. And have the question graded by more than one examiner, then can take the average. Okay. Reasoning questions. Restricted response essays, short answer questions. We are keeping all these questions, use these components in structured essay questions and also modified essay questions. All these types of questions we are incorporating in structured essay questions and also modified essay questions. And also we are using these questions in viva voce, isn't it? You can say the reasoning questions, short answer questions, or restricted response essays, questions what you are framing can be used for even viva voce. Is a part of formative and summative assessment also. For example, reasoning questions. I gave some examples of reasoning questions. Why thiazides are preferred in treatment of hypertension in elderly? They have to give the reason here. State the antihypertensive effect of ACE inhibitors. Why ARBs are preferred in treatment of hypertension in diabetes mellitus patients? So here these are the reasoning type questions or restricted response, RREs, restricted response essays. Then when beta blocker should be considered in management of hypertension. So that gives the reason here. What are the short answer questions? Questions that can be answered with short responses. Remember here, short structured responses. Answers usually 2 to 5 lines only, often simple recall. Most of the short answer questions are simple recall type questions only. So example, I will show you something. So in short answer questions, avoid verbs that invite lengthy answers like discuss, describe, explain, outline, comment, write short notes on, like that. So don't use, if you want to make any short answer questions, don't use these verbs. Because answer will become longer, isn't it? So you have to only, use a part of the formative or summative assessment, used in to test lower level cognitive domain. The short answer questions can be used to test the lower level cognitive domain and assessment of clinical reasoning. Clinical reasoning, there you can go for this type of short answer questions. More content coverage, because if you use the short answer questions, you may cover the more content of the subject can be covered. You see here, for example, for short answer questions, list or name, but don't use the compare or differentiate, describe or explain. That should be avoided. That's what you can avoid. Words that invite lengthy answers like discuss, describe, explain. This should be avoided in short answer questions. See the short answer questions, can say fill in the blank, can say draw the structure of cholesterol. These are short answer questions because unique on the one best response type. Then you can say enumerate 3 causes of massive splenomegaly. Enumerate or list, because here there is no, because very easy, the open short answer questions here, 2 marks. Or list 4 drugs that arrest the progression of heart failure, like that. These are the short answer questions. I am not using the word essay question here, short answer questions. We can incorporate the short answer questions in a structured essay. Please remember here, we can incorporate these short answer questions in structured essay. We can incorporate restricted response essays or the reasoning questions also in structured essay questions. Merits easy to set, fast to mark and consistency in scoring, and improve objectivity as the marking scheme can be structured, and difficult for students to guess the answer. They can be used as a part of the formative and summative assessment, and subjectivity in assessment is less compared to long essay questions. The language is not a barrier. Sometimes long essay questions, if they don't know English language properly, they may not able to write, but this type of questions they can easily answer. Demerits, they can be difficulties in grading if the question is not structured or worded carefully. Students may often memorize. This is the most important demerit here. Most of the short answer questions, they memorize. For example, classification of the drugs and all. The list means immediately they memorize and tell that. That's what students may often memorize short answer questions with rote learning. And construction of vignettes and the key require careful deliberation. Construction of the, because you see the short answer questions we can use in short essay question. Means what I mean, the problem based, we can say the structured essay question I told you. Other one is the modified essay question. Modified essay question is case based learning. case-based essay question, isn't it? So there you can use the short answer questions. I hope you understood. Short answer questions you can incorporate in long essay questions, and also in structured essay questions, and also modified essay questions also you can incorporate short answer questions. And same short answer questions you can use even Viva OC. Can I quickly, after this I think MCQ it can start. Any questions regarding? Finally, you should remember the question should be, all essay questions should be structured or modified essay questions should be framed. You should know how to make structured essay questions and how to make modified essay questions. Not only the long essay questions but also short 5-answer questions also. Can say short essay questions also, the structured short answer essay questions and modified short answer essay questions are there. So always you can use different components for this structured questions. What components you can utilize? Either short answer questions or restricted response essays, that one, or reasoning questions. So all can incorporate in structured essay questions or even modified essay questions. Okay, I think Kishore can have the 5 minutes you can after. Yeah, 5 minutes you can.
10 minutes, sir. We'll have a small break, 10 minutes break.
ఈ మైక్ పనిచేస్తుందా? ఈ మైక్ పనిచేస్తుందా? ఓకే. In most of the countries, assessment will be done through MCQs, not the essay questions or whatever it may be. The essay questions we can assess more effectively compared to the theory questions what we are doing. Maybe in India, future, now they start at 20%, future it may be increased to 50%, later they may switch over to even 100%. They may use the MCQ for the assessment. So you should understand the importance, the learning objectives of merits of well-constructed MCQs, apply the basic rules for writing MCQ items, include stems and options, construct MCQ single best option type. Of course, time permits, I will discuss about the extended matching type. Otherwise, I will focus only on single best option type. This is the one actually we are using so far. The second one can be used in the clinical subjects more. It will be much more useful, but at present we are not using the extended matching type MCQ. But if time permits, we will discuss. Otherwise, skip that one. Create effective clinical vignettes for single best option type. This one, MCQ, of course, extended matching MCQ type. So merits, first we will discuss the merits of MCQs. More reliable in testing knowledge than traditional essay questions. Traditional, I use the word traditional, but maybe the structured and modified essay questions also may be quite useful in assessment. But traditional essay questions compared to MCQs are we can more reliable. Exams are time efficient, we agree. Short exam still allows to assess nook and corner of any topic. You see the 100 MCQs are 120, 140 some subjects. So you can cover every nook and corner of the subject. But MCQ essay questions it is not possible. Well constructed MCQs can assess higher order cognitive processing, interpretation, synthesis and application of knowledge. So compared to the theory MCQ essay questions, sometimes it is not possible. Focus on broad representation of course material, so validity of the assessment increases with the MCQs. Reliable, discriminatory and cost effective. Discriminatory in the sense here we can this MCQs can discriminate the but definitely the good bright student and very effectively compared to the. So nowadays some of the students they are scoring very high marks in theory when you conduct the theory examination, but when you make the simple MCQs they are not able to answer. What does it mean? They don't have any concept. They just can be study some substandard textbooks and maybe the previous questions, and based on that one they are answering. They are still scoring, but their concepts will not be there, and they cannot become a good doctors. Ease of marking by computer. Very quickly you can assess the MCQ exam. There is no time, within no time. The moment exam can be conducted within 100 MCQs, 100 minutes, it is over. Then another 30 minutes you can get the result. Can be stored in item bank and reuse. And however, construction of good MCQ item takes time. It is not that easy. You have to, if you construct a good MCQ item, you have to plan, you have to, definitely it is not that easy, it takes some time. Okay, terminology, you can see this MCQ, this is the stem, this is the options and responses here. One correct response will be there. This is entire these things, stem and options, we can call it as item. Both stem and options we can call it as a item. The stem presents the problem. This is the key response here, correct best answer, and others are the distractors. All the distractors we have to make in such a way, they should be, this quality should maintain, appears to be reasonable answers. Suppose the student is not, no knowledge means That's what appears to be reasonable answers to the student who does not know the content or subject. Options include the distractors, of course. This is the one. You can see here. Options are clearly correct answer and plausible distractors. What do you mean the plausible distractors? This is what I was telling you. Appears to be reasonable answers to the student who does not know the content. That is a plausible, because you have to make the distractors in such a way, this distractors appears to be reasonable answers to the student who does not know the subject. Here, format, always I suggest, whenever you are making for your subject, some particular format you can use. That's what you can say that I just projected this one. Why this particular format should be standard? If you use the standard template, standard MCQ template, advantage means this template here, whatever you type here, it will become bold. Already options A, B, C, D will be there, and here if you write any option, that will become, the starting letter will become capital. Like that, that type of template if you use, you can save the time. And suppose if you want to incorporate any MCQ in between, you can bring it and put it here, number changes. So in that way, if you can use that standard template like this, while making an examination with MCQ paper, so you can bring any MCQs and incorporate, and automatically number changes, and whenever you make any MCQs here, it will become the stem will become capital, and here this all options starting will become capital, this will be there. And of course you can use this type of template also. So here precise and concise wording, options and all should be concise wording should be there. Stem use bold letters, and responses should be preceded with ABCD or ABCD, not 1, 2, 3, 4. Always have to use that one. This is the MCQ. You can see here the two MCQs. Which of the following adverse effects of propranolol is due to blockade of beta 2 adrenergic receptors? For example here, is the stem meaningful by itself? Yes or no? The first one. Which of the following adverse effects of propranolol is due to blockade of beta 2 adrenergic receptors? Is stem meaningful by itself? Yes. Here, in contrast to most general anesthetics, this agent is particularly useful at sites of accident where modern equipment is lacking. Is stem is meaningful by itself? Or can say, is this stem is presenting the definite problem? You have to see the stem should be, okay, anyway, we can discuss about this one. Definitely, here the stem is meaningful and also presenting the definite problem. Our response are plausible. Plausible. I told you what do you mean the plausible. See, for example, here, bronchoconstriction, bradycardia, heart block, congestive heart failure, all are related. Some of the adverse effects only, all are similar, isn't it? Definitely, if someone doesn't know the subject, he cannot pick the right answer here. So here, can say that all are drugs only. All are drugs only. Here at least, even this also you arrange it in alphabetical order. Here also are arranged in alphabetical order. So our response are plausible. So can non-competent student pick it is impossible to non-competent student can pick the right answer. So that's what distractor should be plausible. That's what very key point you must remember. So here all responses are homogeneous. Will agree or not? Responses are homogeneous. Responses are plausible, and stem is meaningful by itself, isn't it? So like that criteria you should maintain most of the MCQs. You see here, for example, female sex hormone is it plausible or dummy distractors? Dummy distractors. Okay, good. So if you want to say all these options are dummy or plausible, the female sex hormone, if you say all the hormones are there, so then you put in alphabetical order, then definitely a student, if he doesn't know that knowledge, cannot pick the But here you can exclude all these gases here, nitrogen, oxygen, because maybe all are androgen, estrogen, gens looks possible, but it is not possible there. So retention polyps of large intestine occurs. So here you can see, is stem meaningful by itself? Huh? Is it connected to the responses? Huh? It's not connected. So if you want, that's what can say, the stem should be a question, the stem should be either question or partial sentence connected to responses. Please remember this one, either it should be a question or partial response that should be connected to response. So these are two features you must remember. Either it should be a question or it should be connected to responses. See now the peak age of the occurrence of retention polyp of large intestine is. Now it is connected to this one. Isn't it? It is connected here. Earlier it was not connected. It does not. Stem is meaningful by itself and stem is connected to responses. So we can see the same thing because ears are there. The move repeated text to the stem if possible. Which is the repeated one here? Ears. That you can move to the stem itself. For example, you can write the peak age in years for the occurrence of retention polyps of large intestine is. Now ears you can move it to the stem. All the options can become shorter here. So now you see that this particular MCQ. So what is wrong in this? Is stem presenting definite problem? Is it presenting definite problem? Yes or no? Not, isn't it? Because you say, which of the following is true about pseudo-gout? It is as if a true-false type of MCQ. We cannot use such type of MCQs here. True-false type MCQs here. So the stem should be meaningful by itself and should present the definite problem. So it is not like the true-false type. This is a true-false MCQ. So responses are homogeneous. Responses should be homogeneous. Are these responses are homogeneous? Right, one of the things you must remember, all the responses, options should be homogeneous. Are these homogeneous here? See, one is the gender, other one is the location, other pathology, genetics, pharmacology, like that. So such type of things can be used in true-false type of MCQs, but not in our setup. So which of the following statements regarding glucocorticosteroid therapy is incorrect? So now these the options are homogeneous. Are the options are homogeneous? All are depending on the dose only, isn't it? So there appears to be homogeneous here. Response are homogeneous, but which of the following statements regarding glucocorticosteroid is incorrect? So that means response are homogeneous, but it appears some extent we can use sometimes in pharmacology when you want to use such type of questions can be used, but generally that type of questions can be used in a true-false type of MCQs. Better you can rewrite the same one. Glucocorticosteroid is harmful when, so now it is connected to when prolonged large dose therapy stopped abruptly. Instead of writing like this, you can write like this. See here options are homogeneous, but maybe it looks like some of the true-false type of MCQ. So instead of that one, you can modify like this. In hemolytic anemia, the lifespan of red blood cell is reduced. What is the normal lifespan of human? Okay, this one and this one. What is your comment? What is these two MCQs? What is wrong in this? Without this, without the first sentence, still you can frame the MCQ, the window dressing. So it is better window dressing can be avoided. That's what avoid window dressing. So suppose if at all, if you want to put the window dressing, you can instead of putting this one, which of the following antibiotic used to prevent the treat infection in this patient without putting Bacteria fragilis. If you are putting this one here, then window dressing is required. Otherwise, that particular sentence is not needed in this particular MCQ. Adverse effects of alpha-adrenergic blockers include. What is your comment here? All of the above can use in MCQs actually. All of the above. What is wrong here? Avoid options such as all of the above, none of the above, both A and B. Why should avoid this one? They reduce the number of distractors. They reduce the number of distractors and increase the chance of guessing. Will you agree? All of the above increase the chance of guessing and reduce the number of options. So that's why it is better avoid all of the above, none of the above, both A and B. Alpha-adrenergic blockers produce all the following adverse effect except. What is the problem here? Is there any problem in these two MCQs? Same thing, of course, you have written the which of the following is not an adverse effect of alpha-adrenergic blocker? Both can be used or anything is Of course, some subjects like pharmacology, generally we should avoid this, except such things should be avoided in MCQs. But in some subjects, adverse effect, when you say want to, so it is permitted. So, but anyway, we can say instead of putting the except here, you can frame like this. Is not an adverse effect of alpha-adrenergic blocker. This may be better than this, if we can convert to in this pattern. The stem should be negatively stated only when significant learning outcomes require it. Like in pharmacology, sometimes we want to check whether student can remember the particular adverse effects or therapeutic uses. Sometimes we may use. That's what can say should be negatively stated only when significant learning outcomes require it. None of the following is not found in the normal peripheral blood smear except. Too many? What is the problem in this? Using double negatives. It will confuse students. So what you can write? Which of the following is single, not normally found in the peripheral blood smear? So single negative is can be, but double negative should be avoided. At what age does a normal child starts walking? What is wrong in this? What is wrong in this? Mutually exclusive, because we don't know the normal child can walk. It is not the cannot say a particular this one. That's what alternative should be mutually exclusive. We cannot here we cannot alternatives are not mutually excluded here. Shock is defined. What is wrong in this?
Long options are right.
Okay. So one is the long option. Make option similar in length, complexity and style. Always there should be, you cannot make these options. Automatically if you make like this, students can pick the that one only. the peak age in years for the occurrence of the retention polyp of large intestine is. So now what is wrong in these two?
It is not arranged alphabetically in descending order.
So thing is, such type when it comes here, you better responses should be presented in logical order. Better you put them in logical order. Say we can start with the 5, 15, 25, 35 like that. Suppose here 15, 25, 35 you put like this. Student may get a clue. So always put here, even drug's name, put it in alphabetical order. The cell which is associated with allergic reaction is, what is wrong in this? So grammar. So easily can pick. So how you can write this one? A or an you can put. The make option similar in grammar. Then the most effective prophylactic agent is preventing recurrence of rheumatic fever is. So can you ask that type of MCQs?
It is not homogeneous.
So because easily can pick the pencil in here. So that how we can write this type of questions is, the most effective prophylactic agent in preventing recurrence of rheumatic fever, you don't put the pencil in here, none of the above, then you can check such type of answers. None of the above, only such situation you can use. If you want to, what you can say, the no available options are correct. So here in that case you can put so suppose here putting if you put this question, student can pick the penicillin very easily. They are only antibiotic and so they definitely can pick. But if you want to check that knowledge, can put like this, can put the none of the above. Don't put the penicillin here. Penicillin is the right answer. If you put, easily can pick the correct option. So use none of the above with caution only when there are absolutely correct answers to the question and none of the available options are partially correct. Which of the following antihypertensive drug may cause hyperkalemia? So this is it okay? There are many other antihypertensives also can cause hyperkalemia. In that case, we cannot use this one. If the no other antihypertensives are causing hyperkalemia, then you can use the none of the above here. So like that, you can modify this one. So some available options are correct. So avoid none of the above in this particular item. So you can, instead of this one, you can change to which of the following antihypertensive drug may cause hyperkalemia, and you put this one. So this avoid none of the above in such cases. Why it is avoiding here? Because among antihypertensive drugs, some other antihypertensive drugs also can cause hyperkalemia, like beta blockers, and of course, and say thiazide, beta blockers, ARBs also can cause. And aldosterone receptor antagonist. Okay, anyway. So what is wrong in this? Which of the following drugs and their adverse effects matches correctly? And here, drug combinations is most likely cause of the toxicity. Maybe if you want to some of competitive exams, you can but generally we should avoid such a. So that we can say the reason is complex multiple choice items should be avoided generally. But the question may be right, but it's better to avoid such complex multiple choice items. Tips to writing quickly, can see the whatever we discussed so far. The stem should be meaningful by itself, should present a single clearly stated problem or question. Never ask which of the following is true or false. Then the stem should not contain irrelevant material, that window dressing should be avoided. They include most information in the stem so that options can be short. State the stem as a question or an incomplete statement. These are the two things. State the stem as a question or an incomplete statement if needed to avoid awkward wording. Only you go for this one, so don't use the awkward wording in the stem. Be as brief as possible and avoid undue complexity. Avoid negatives, idioms or absolutes. Always, never, such things should be avoided in the item stems. Item stem means that item means is a MCQ item. MCQ item stems are there, options are there. Now we are discussing about stem. The stem should be negatively charged only when significant learning outcome requires it. When making the stem an incomplete statement, make sure that options follow the stem in a grammatically correct manner. Grammatically correct manner, okay. Now tips writing the options. Write the correct answer first and then write the incorrect options in the parallel style. Make sure there is only one best or correct answer. Vary the positions of the correct options. This is very important. Otherwise, if you are keeping all correct options C or B, one defined some students may be benefited. Make options similar in grammar, length, complexity and style. Move repeated text to the stem if possible. Alternatives should be stated clearly and concisely, mutually exclusive, homogeneous in content, free from clues about which response is correct, and presented in logical order to avoid bias towards the certain positions. Make all options plausible to students who do not know the correct answer. Avoid all of the above, none of the above, or both A and B to decrease the possibility of student guessing, and use none of the above with caution. Avoid absolute terms or vague terms, and avoid complex multiple choice items in which some or all of the alternatives consist of different combinations of options. Okay, now we will come to the writing a single best option type MCQ. First, what you have to do is write options first. Write options first. Write a list of options based on selected topic, context, that means theme and sub-theme. First you have to, for example, I will give an example also later. So the option should be readily understood and as short as possible. Start the list of more than 5 options. It is important that there is a list of homogeneous. All the options should be that is very, we discussed that one. Whether should be on the diagnosis or therapeutics or lab investigations or complications, should be all, they should be homogeneous in nature. The avoid distractor should be, a good distractor should be inferior to the correct answer, but should be plausible to the non-competent candidate. Definitely inferior but non-competent, the student who doesn't know the subject, so definitely will not be, should be able to pick the wrong option. Okay, so now you see a question stem is then written with the lead-in statement based on the selected correct option. Focus this particular clinical vignette whether suits for our particular SLO. That also is important here. Then able to test higher cognitive skills. This is higher cognitive skills also you have to focus. The good clinical vignette. Okay, this is of the Bloom's taxonomy. You can see, remember this is a recall type, but when you go move up the apply, analyze, evaluate, create, see the elements of clinical vignette. What are the elements should be there in clinical history, family history, physical findings, diagnostic studies, initial treatment, subsequent, whatever it may be, generate. For example, you can see all these headings are there in this particular clinical vignette. You can make the clinical vignette like this. So now you see for example, this is the clinical vignette with investigations are there. The lead-in, after the clinical vignette like this, you put the lead-in question, that is the most likely diagnosis is. You are giving the clinical story here, some investigations here, the most likely diagnosis is. So the key answer here is the ascending cholangitis, like that. We all are, the remaining things are the distractors. Clinical vignettes. Now that is the thing, the most of the MCQs also in university examination, they are making from the clinical vignettes, and also we have to increase the number of these MCQs and the clinical vignette based MCQs. The golden rules for composing relevant clinical vignette: hand cover test. That means the case whatever it is there should be able to answer without looking at the options. What is the right answer? And test higher level of the Bloom's pyramid, not be merely window dressing. Window dressing should be avoided. Okay, now one clinical scenario, you can develop several MCQs. I will show you that one here. You can say a single patient vignette can be used to generate 3 or more lead-in questions followed by homogeneous options related to the lead-in. Even more than 3 or 4 MCQs and the clinical vignette based MCQs. So that can say single jump, double jump, triple jump. You can see one example I have given on the basis of pharmacology here. 29-year-old woman with history of mitral stenosis has paroxysmal attacks of rapid heart rate with palpitations and shortness of breath. Her ECG reveals atrial fibrillation. Which of the following drug is used to terminate the attack? Which of the following drug is used to decrease the ventricular rate? These are the goals actually in atrial fibrillation. And which of the following drug is used to prevent cerebral stroke? This is a common, like that we can, what the one clinical vignette, you can make several questions like this. So the template for using diagnostic studies, for example diagnostic studies, clinical vignettes, how can items 10, patient vignette. After patient vignette, what you have prepared like that. After that, what you can do? Lead in. Which of the following is most appropriate next step in diagnosis? You are giving the some of the thing, whatever this thing. Which of the following is the most appropriate next step in diagnosis of this condition? So options, list of the diagnostic studies you can put. So like that, clinical patient vignette followed by lead-in statement, then options you are giving. Then template for mechanism of diseases, patient vignette, case history, item stem you are giving, lead-in. Which of the following is most likely explanation or cause for whatever it is. So now here you are testing the template for mechanism of disease. So items related to the physician task, begin the item with the clinical vignette of the patient and the symptoms, signs, okay, history, we all as the questions lead-in statement, you can see the diagnosis. For example, some of the lead-in questions, because all the vignette, after vignette clinical case history, you are putting the lead-in questions. What is the likely diagnosis? What investigations can be done? So, for example, here can say items related to physician's task. Give the clinical vignette. Which of the following is most likely diagnosis? Then, which of the following is the most appropriate next step in diagnosis? Which of the following is most likely to confirm the diagnosis? You see, now you can put the options. If you know the subject, see the same clinical vignette you are using, but by changing the lead-in questions, you can generate various MCQs here. One single clinical scenario, so can say the most likely diagnosis, most appropriate next step in diagnosis, most likely to confirm the diagnosis, like this. The management, if you want to management, clinical scenario followed by which of the following is most appropriate initial or next step in patient care, which of the following is most effective management, which of the following is most appropriate pharmacotherapy. So like that, all the clinical vignette base, the lead-in questions, the clinical vignette followed by lead-in. So for that you have to choose the options as to make any MCQ. I told you, on the basis of the theme and sub-theme, you have to select the options first. one right option should be there. Then you generate the clinical vignette and lead in question. So mechanism of disease can say most likely, which are the following most likely clinical case followed by lead-in questions like this. Is the most likely location of the patient's lesion. Which are the following is most likely pathogen. So like that, lead-in questions, clinical vignette followed by lead-in questions. A patient description has, okay, anyway this is a, can some example, patient description has a type of injury or location. Which of the following structure is most likely to be affected? You see the same vignette you can use. Here description of the patient or the type of injury and location. Which of the following structure is most likely to be affected? Here patient description, history findings and the medications. Which of the following medication is the most likely cause of this adverse drug reaction or lab finding? So next, a patient description and abnormal findings, which additional finding would suggest a diagnosis of disease 1 rather than disease 2. See the higher order MCQs you can generate like that. Then a patient description symptoms and signs, these observations suggest that the disease is a result of the absence or presence of which of the following enzymes or mechanisms. So like that there are many examples. Patient vignette followed the specific dietary regimen. Which of the following condition is most likely to occur? So I hope you understood the physical case scenario. After that you can put with the leading statement questions. You can make so many higher order MCQs. Say following procedure. Patient description, develop signs and symptoms. Laboratory finding shows these findings. Which of the following is most likely cause? Like that, all these types of media. You can also use the media in the MCQs. Some of the medias also you can incorporate in MCQs. That is images like X-ray, CT scans and MRIs, or patient photographs, videos and interactive media also. Avatars also can. I just gave some example here. See the dermatological muscular examination findings. They can say examination of the dorsum of the left hand shows lesion. I put the diagram here, flesh colored. Which of the following is most appropriate next step in management? Now you are using the picture here. So now you can see the other here videos. You can use the video here. Here the tremor. His visual vital signs are within normal limits. The remainder of play the video to view the exam. You have to play this video, and which of the following is most likely diagnosis on the basis of this video. So they have to videos also can be used. Clinical vignettes followed by video. Then you make the options. Then here the avatars can say avatar is shown here. You can see, I think picture is not clear here. You can see what I can say, which avatar, which of the following is most likely finding on cardiac auscultation. Practically here, which of the some areas is there. So on the base of this avatar media, we can use, clinically we can test. So whether the student is able to identify, find out what murmurs are present. Finally, 10 important guidelines in MCQs is a formatting. And STEM should represent single formulated problem. Cannot put too many problems, single formulated problem. Responses should be homogeneous. Avoid window dressing. Try to avoid negativity in STEM. Highlight the negativity. How can highlight the negativity? Bold letters and underline. Any negative. Incorrect or not or except, all those things should be bold and should be underlined. Logical placement of responses is important. Then avoid all of the above, none of the above as much as possible, and avoid this one, cluing also should be avoided. test basic fundamental points only by using none of the above. Rarely, as I gave an example, in such situation only you can use none of the above, otherwise you should avoid none of the above. Okay, finally, I think I will stop it here. Item analysis, there is all the MCQs, whatever you are conducting, MCQs, then you can see the difficulty index, discriminative index, whether these options are plausible or not, also we can analyze. That's what, just an example, just quickly, when you put the item analysis like this, you see A, B, C, D, this is the correct option, but these are the students, they put, the more number of the students, they put it is wrong here. So like that, whatever this data, you can analyze difficulty index, then also you can discriminative index, also you can estimate, and finally you can effectiveness of the distractors also you can assess. Effectiveness of distractors. How we can assess the effectiveness of distractors? You can see the key one. There is a score here, of course. Anyway, I'll stop it here. Anyway, this is takes time. Okay, thank you. Because this will take time to explain, I'll stop it here. Because so that also we can assess the effectiveness of this. Any question?
Day 2 feedback form is just shared in the WhatsApp group, so please give the feedback.
Few instructions for tomorrow. Tomorrow will be our last session, last day of the entire program complete. Important instructions are, one is rapporteur has to be there by 8:55 with the report, today's report to be ready, and tomorrow's evening report also has to be ready by a rapporteur. So Dr. Abrar has to be taking the note of every session that is happening, and after completing the entire session, tomorrow evening only you need to present. Okay, so there is no time for you, you need to check the things. So that is one thing, and another is, so the group leaders are being set in the first day, right? If not, any other from the group can come forward. You have already selected, a competency is being given to you, already you have prepared the SLOs and teaching learning methods in it. Now the same thing, please prepare it in a PowerPoint. Okay, the format that is being given to you, I think on the day one we have given the format to you as a Word document. The same thing you can make in one single slide. Try to make it in one single slide, or otherwise it can be a 2-slide. But see that the competency comes, competency with the competency number, all the specific 1, 2, 3, 4, 5 specific learning objectives, the teaching learning methods, what are the various teaching learning methods, and tomorrow once the assessment part, assessment part is completed, you will be finishing the assessment, and then the same thing will be entered, and one person from each group has to come and present to the entire group, and reflections from the other groups will be there. So discussions and reflections, any deviation of the SLOs or whatever it is, entire group will be looking into it. Please keep quiet, please. Please listen to this, because tomorrow's work you need to do it, and probably afternoon session will be this kind of interaction, and probably finishing of it will be having a valedictory. Right. Thank you.